Good afternoon, everyone. So, dear participants who are here in physical mode as well as those participants who are in the online mode across the country, welcome to the program on autism awareness. So, we are on behalf of Director NIPID, I welcome you all for this 1 month long program on autism awareness, which is being organized by NIPID, which we started from 1st April onwards. So as a part of this, we are conducting different programs across the country, like programs which is being conducted online. Then physical mode different programs has been conducted by NIPID headquarters and its ARCIS regional centers and composite regional centers across the country. So as a part of that, we started the program having a awareness walk on autism. That was the first program which we initiated as a part of month-long celebration of Autism Awareness Month. Starting from that, we had flash mobs in different locations in the Hyderabad and across other parts of the country also, like regional centers has done programs in different other parts of the country. Then we had a blue rally on 3rd April, which was like a very huge program, which around 1,000 participants participated in autism awareness rally, which has been held in Secunderabad, and same kind of rallies has been organized in Delhi, Mumbai, Kolkata, and other so composite regional centers also. Then on 4th, we had a program on online quiz on autism awareness that has been conducted online, and we had around 500 registrations for that program, and around 375 participants participated in that online program. Then today we are having an program, hybrid mode program, like online versus offline program on autism awareness, which is meant to create awareness about autism on different aspects from a cross disability approach. So we'll be having sessions from different professionals dealing with children with autism. So this program will be like held in the NIPID headquarters, which will be live telecasted in YouTube as well as through Google Meet. Like I think we have a lot of participants joined in Google Meet, as well as YouTube Live is also being streamed. So today's program is mainly focusing on giving overview about autism from different perspectives, from medical perspectives, therapeutic perspectives, educational aspects, psychological aspects. So different professionals dealing with children with autism will be delivering their lecture based on their role in managing children with autism. So that is the major program which is going to happen today. So I think we will start with the first lecture of the day. So we'll be having first lecture by medical perspectives on autism by our own faculty, Dr. Shravan Reddy. So sir is an assistant professor in psychiatry in NIPID headquarters. So sir will be giving on a lecture on medical aspects of autism, then followed by different lectures like lecture on educational aspects, then psychological aspects, therapeutic aspects. All those things will be delivered by different professionals. So first of all, I welcome Dr. Shravan Reddy on behalf of Director NIPID and all others who joined online as well as who are assembled here in the auditorium. Welcome, sir, for the first session. Thank you.
Thank you, Dr. Ambadi, for the introduction and the activities what we have done from the last 1 week on the occasion of Autism Awareness Month. And I welcome all the students and all the online and offline participants who are attending this webinar. I think it's already we are running late, so with this introduction, I will start regarding the medical aspects of autism. So as you all know, every year we are celebrating this World Autism Awareness Day. So every year we are celebrating on April 2nd to create awareness among the general public, parents, stakeholders, and common people, college students, and general teachers. So those are generally the autism is a new term. Even now we are thinking as we are working in the same field. So for us, this autism is not any new. But when you go to the rural areas and other parts of the country where there is no much healthcare facilities, so they think autism they don't know. So they say only that some kind of disability. They don't know what are the symptoms. So what are the warning signs? So why my child is getting autism or what are the causes of autism? So just to create a basic awareness, I will be talking on the medical aspects of the autism on today. So what is autism? See, generally autism is very simple. When you open the book and read in one page, so you think that I know about autism. So only there are three main domain symptoms. But autism is not a single disorder. It is a spectrum disorder. So what we say is autism spectrum disorder. So spectrum is it involves a lot of challenges, lot of behavior, and there is a lot of emotional behavior, anxiety behavior, behavior problems, cognitive problems, speech problems. So autism is not a single disorder. It's a very complicated thing to understand for autism. So though we are working from the last 10 years in this field, daily we are upgrading our knowledge on the autism. So just reading 2-3 lines in the book, so we think I know about autism, that is not correct. So autism, there is a lot of research going on in the autism, in the medical field, in the therapeutic field. So there is a lot of huge research and lots of crores are spending in autism to identify it at an younger age, or autism can be cured or it can be completely eradicated like that. The research is going on. So autism is always unique, totally understanding and sometimes mysterious. So if you are seeing a one child with autism and you are comparing with the other child with the autism, same features, but both are entirely different. The same therapy as a professional we are working at the behavior modification or the classroom setting when you are dealing with one child with autism, the same may not work for the same child. So though both are having diagnosis of autism, so the challenges, the limitations, the behaviors, and the sensory issues, there will be a lot among the autism. So each child is a unique and different child in autism. So whenever you are designing a curriculum, the same curriculum or the same approach doesn't work for the same child in autism. So this is very, very important and the basic point in understanding the autism when we are giving the intervention as a special educator or a psychiatrist or a medical professional or some other rehabilitation professional. So generally just I am giving the brief introduction. So autism is not a new term. It was generally discussed in 1943 by Dr. Leo Kanner. So there are initially autism is not, they kept as an autism spectrum disorders. Initially there are a lot of disorder like Asperger's syndrome, childhood disintegrative disorder, Rett disorder. But in DSM-5, what we follow in the medical terminology is the DSM-5, Diagnostic and Statistical Manual 5. They removed all this terminology because there is a lot of confusion in the general public or among the healthcare professionals. So what is Rett disorder or what is Asperger's syndrome or what is Rett disorder or what is childhood disintegrative disorder or what is pervasive disorders or what is unspecified autism. So there are different terminology. To remove all this confusion, so they have kept only the single terminology, that is autism spectrum disorder. So earlier we made the diagnosis of Rett disorder, particularly women. So Rett disorder you can see in the females like that. And Asperger's syndrome. So in Asperger's syndrome there are not much deficits in cognition and the language, but you can see deficits in the communication. So that is like high functioning autism in Asperger's syndrome. So to remove all this confusion, now they have nominated a single terminology, that is autism spectrum disorder. So just I am not going into the different parts, what is Rett disorder or what is Asperger's syndrome, okay, no, all these things. So what is the prevalence of autism? So this is very, very important. So when you are taking the data from the last 40 years or 50 years, so year by year you are seeing there is a lot of prevalence in the autism. So there are more number of new cases, okay, no. So this is because of lot of awareness among the healthcare professional and other things, lot of activities like NGOs, like NIPID and other national institutes, and also the contributory factors in the environment like late marriages, late pregnancies, genetics, okay, no. and also high risk factors, stress during pregnancy, and also mostly the genetic factors, and also the genetic counseling what we are not doing in the pregnancy. So all these contribute to the autism spectrum disorder. So you can see this is the latest data. In 2018, the data says about 1 in 59 have autism. Suppose today there are 100 children born in birth, there is a delivery of 100 children. You can see one out of in them 1 in 59 they are having autism. So now the prevalence is increasing gradually day by day. So now the prevalence is around 1 to 2% the autism spectrum disorder. The 2022 census says it is 1 in 42. So for every 42 children born, there is a one child suffering with autism. So day by day, the autism prevalence is increasing. So then what is autism? So everyone has the question, what is autism, what is ID, or what is epilepsy, or what is ADHD? See, all these are the neurodevelopmental disorders. So the name itself, neurodevelopmental disorder. So there is some amount of abnormality in the brain development. So during the birth time, during the delivery time complications, or in the mother's womb. So in the formation of the brain structures, or abnormal connections in the brain, or abnormal connections in the hemispheres, or abnormal communication between the two hemispheres. So all these contribute to the autism. So autism is a neurodevelopmental disorder. Okay, this autism, ADHD, mental retardation, learning disabilities, epilepsy. So all this comes under one category, that is neurodevelopmental disorder. So like other disorders also, the autism is very highly prevalent in male gender. Okay, no, when you are taking the, you can take the general services census or CDIC census. You can see the autism is highly prevalent in the male gender. So it is because of the genetics or the chromosomal factors or because of the hormonal factors like male hormones. All these things contribute to high development of this neurodevelopmental disorder. But you can see in female gender also, but the ratio is around 4:1. And autism, it's not only occur in India. So autism is an worldwide disorder. So irrespective of your race, religion, your country, and your socio-economic status, you can see autism in all age groups. So what are the symptoms in autism? So first thing is you can see there are three main core domains in the autism. Okay, no? The first thing is there is deficits in social communication, and other thing is there are problem in the cognition, and other thing is you can see there are restricted repetitive stereotypic behavior. So but according to DSM-5, these three are the very common symptoms, but there are some other symptoms you can see in autism which support the diagnosis. You can see there is hyperactivity, there is no eye to eye contact. You can see autism children, they stay to prefer alone, they try to play alone. So when you are calling their names, they don't try to respond when you are calling for the first time. Okay, no? And also they are having sensory issues, they may be hyper or hypo. So sometimes like in all the senses like smell, taste, vision, touch, so in all the senses, hearing, so they may respond hyper. Some children may be hyper to the sounds, some children may be hyper to the sound, some children may be hyper to the touch, some children may be hyper to the sound. So in all many cases of autism, nearly 70 to 80%, your sensory integration disorder. So sensory, how your senses and brain coordinate. Suppose I am talking, you are listening. So you are listening in a normal way. But when there is a problem in your sensory integration, when the balance or the communication between your senses and the brain is lost, so you can see the presentation will be abnormal, like hyperactivity or hypo, responding or not at all responding like that. So in all the senses. And you can see autism children, when you are giving a toys, they doesn't play like a normal children. So they try to see like a tunnel vision, or in a line they will be keeping some peculiar observations they will be doing. And also you can see in autism there is a speech regression. So generally in many children they may have speech development initially. Again you can see regression. So whatever the child has learned, there may be regression in the speech. And also you can see depression, and also there is less emotion. So when someone try to hug or take care of a child with autism, they can see rejecting hurdles. And also many of children with autism, they have problems with the sleep, like the biological parameters, like sleep and appetite. You can see autism children, they don't like eat like a normal children. Suppose if you are giving like 10 foods, they like only one or two specific foods, like fuzzy eaters, they are autism. And also they are having sleep problems. Particularly you can see many children with autism, they have problems in the speech, like sleep, whether it may be in the initiation of the sleep or the maintenance of the sleep. So common signs you can see in autism, there are some differences you can see in autism in girls and boys. So generally girls are better responding to the non-verbal cues and gaze following. But in boys, they are very poor responders to the non-verbal cues and gaze following. And females, their obsession over socially acceptable interests like TV show. But in male children with autism, they have unusual interests such as like daily routine, schedule, or they want the same routine. So that's the children when you are handling with some autism children. Suppose today 9 o'clock they want to come to the school. Today is all day. If they doesn't go, they become hyper at that time. So because of the lack of speech problem, they may present like hyperactivity, aggression, irritability, mood swing. So that is the reason when you should not change sudden daily routine of an autistic child. So when you want to change, you should train the mothers that you want to tell from yesterday night. Tomorrow is a holiday, you are not going to the school. Otherwise, they present like a temper tantrum or a self-injurious behavior. So they may not understand for the first time or second time. So you may repeatedly want to tell them that today 9 o'clock we are not having school. So you are having some other. So just you want to tune them and try to change them. Okay, no? But if you suddenly tell them and they may present like some kind of hyperactivity and behavior problems. And mostly girls, they are present as a passive, means they are dull, calm. But in mostly in males, children with autism, you can see hyperactivity, behavior problems, attention deficits, all these things. So generally females, they struggle with communication in the later life, but in boys you can see the communication problems in the even in the younger age. So there are some early signs of autism which we can identify by 6 months if there are no smiles or joyful expression, or by 9 months no facial expression or communication through source, by 12 months like no babbling or no back and forth gestures, or by 16 months no word, by 24 months no meaningful two words phrases. But this is according to the books. But as a National Institute, we are identifying at 3 months, 6 months, 9 months, at much younger age also, we can identify the autism sign. Though we may not label them as autism, so you may take at risk for autism. So your child, there is some deviation in the normal development of your child. So you want to counsel the parents. So these are some warning signs that I am seeing. So you want to do these kind of activities, you want to give much time to your child, or you want to do some kind of emotional bonding, or you want to do some kind of intervention. So at-risk child can be reintegrated into the normal child, like normal child. So that is the thing, identifying at 6 months, 9 months, it's very, very crucial. As you all know, the first 3 years has 75% of the brain development occurs, and myelination, CNS myelination, neurons maturation. Again, in the first 6 years, 90% of the brain development occurs. So any child with autism, you are identifying a child at an younger age with any risk factors, you can see a lot of improvement when you are giving appropriate interventions and therapy. So that is the reason early identification is very, very crucial and very, very important in medical part or therapeutic part of any child with autism. So that is the thing why instead of prevention is better than cure. Okay, already they are now know there is no studies like you can end up during pregnancy you cannot stop autism now. As of the literature, medical literature or some blood tests, there is no test you can tell that the child is you are giving to a birth to a child with autism. So as there is no preventive aspects other than some certain environmental factors, other measures. So early identification is very, very crucial in understanding autism and prevention of autism and development, as you know, because of neuroplasticity of the brain. And all these things, universal symptoms, as we are discussing, hyperactivity, repetitive behaviors, and many children with autism, they have obsession and compulsion, stereotyping. So they will be doing the same thing. Like obsession, they will get the same thought, and compulsion, they want to do the act. So whenever you are disturbing them, again they become hyper. So they stick to the same routine daily. Okay, no? And if you are changing their daily routine, they may present like a behavior problem. So then some other symptoms you can see, they doesn't respond when they are calling. They try to prefer alone. They doesn't play with the same age children, and there is no social anxiety at the younger age in autism children, and they are not comforted by other distress, and also they don't understand the boundaries. If someone is telling or someone is trying or what they are talking, so because of the communication aspects and the cognitive aspect, they don't know what they are talking, understanding, and there is little less emotions in the autism child. So this is DSM-5 criteria. I'm not going into the much detail. Okay, no? I think you can go through the books. Okay, no? So, but the problem in identifying autism, okay, everyone can identify the autism, but the main problem is what we are missing is the comorbidities. So, autism is a highly prevalent neurodevelopment disorder, which in more than 70 to 80% you are having some other comorbidity. Like autism, you can have mental retardation. The data says nearly 40 to 50% of children with autism, they have ID, mental retardation. And nearly 25 to 30% they have ADHD symptoms, which is mimicking ADHD, like hyperactivity, attention deficits, executive function, not sitting at one place, distractibility. And many children, nearly 60 to 70% with autism, they have epilepsy also as a comorbid condition. So not only identifying autism is not important. So to overcome the prognosis, to give the interventions and challenges, you should look over the comorbid condition. So you want to know whether the child is an high functioning autism, or the child can improve very fast, or because of these comorbidities there is a delay in the progress and development of the child. So that is the thing, whenever you as a healthcare professionals, when you are doing assessment of it, you should not miss the comorbidities. So the comorbidity is the one which determines the prognosis of the child, whether it may be epilepsy or mental retardation or ADHD or some other kind of genetic disorder or some other medical comorbidities like thyroid problems or some other comorbidities, all these things you should be ruling out. So whenever you are treating the comorbidities only, you can see the drastic improvement. So particularly in autism, you can see the problems in the three levels. One is the intellectual, that is a cognition, thinking problem. Another thing is the communication level, the speaking problem. Other thing is the behavior level. So this is a very common question asked by the parent. So I am normal, my husband is normal, but my child got autism. So what are the risk factors? Why I got? There is no autism in my family, or even in my ancestors, we are not having autism. See, autism is mostly very common. It is a genetic disorder. In more than 75 to 80% of causes of autism, the cause is a genetic disorder. So earlier the scientists have identified more than 2000 genes. Now they have come to 600 or 800. So the research is going exclusively on this gene. So which gene is contributing to the autism? So day by day, a lot of research is going on the genetics of autism. So mostly autism is a genetic disorder. But genetics along with the environmental factors. So it triggers development of this phenotypic expression. And also you can see there is differences in the autism in the male child and female child. The genetics are different for a boy with autism, for a female with autism. And also there are association of certain chromosomes like chromosome 7, 3, 4 and 11. And also mostly it's a neurodevelopmental disorder. Okay, no? And the environmental factors, and it occurs with many other comorbid conditions. Like you can see autism, it may occur with Fragile X syndrome. Okay, no? It can occur with some other genetic disorders, all these things. So that's why genetic counseling is very, very important. Suppose whenever a first child comes with autism, so there is a high chances that the mother is conceive a baby with the next child with high chances of autism. It's not very high means, so at least the chances will be around nearly 20%. Okay, no? So there is a risk of around 15 to 20% when you are giving a second child with autism. And also it depends whether they are monozygotic twins, dizygotic twins, and the family factors and the environmental factors. So there are a lot of other contributory factors in the prevalence of the autism. So whenever you are going for a late marriages, late pregnancy, so there you can go for genetic counseling and genetic screening, at least some kind of parameters. And this is a very common misconceptions in the society that I have given vaccine like MMR vaccine at 9 months, 6 months we have given. After the till that my child is normal. After I given vaccine only my child got autism. But the studies have shown that there is no link between autism and vaccines. So in the younger age, if you are not giving vaccines and you are depriving your child from vaccines, so there is high chances of other comorbid conditions like pneumonia, respiratory infections, rotavirus, diarrhea, all these things you can see. So you want to vaccinate your child, the vaccines has no role. Okay, no, it's a misconception in the society. I have seen some patients that my child after giving vaccine, first child I got, my child developed autism symptoms. So in the second child, we have not given vaccines only to the child. So these kind of things should be prevented. The research shows there is no link between autism and the vaccines. And also, you should not think about only the negative aspects of autism. So, being a parent, you should look about the positive aspects of the autism also. So, every time when you are coming, the clients are coming to you, you should not tell these are the things, these are the problems. So, you want to look the positive aspects of also autism. So, autism children, they are having certain skills. So, you want to educate the parents and you want to create awareness among the parents that there are certain kind of skills where you can look off in a children with autism. So, and autism children, they are very honest, and they have some children with high functioning autism, they are very good memory for dates, and they are honest, they are not dishonest like many of us. So, they do not judge, okay, no, and they can focus and excel in a specific field. If you are identifying the child abilities and you are giving support, you can excel the child in that field, though the child is being autistic. And you can give great attention, and they have one or more highly developed talents. We can see in our children, lipid only we can see they are very good children autistic. We are those who can play the music instrument. Those are very good artists. Painting we can see in our own school we can see. And the positive aspects they have good auditory memory. They are good visual memory, and they are committed, and they can take the concrete decisions, and they are loyal, and they retain the facts. So these you cannot see in all child. Each child may have some kind of these positive aspects of the autism. Till in the last 1-2 slides, what I am telling. So in being autism also you are having many positive aspects. So as a parents, as a caregivers, as healthcare professional, you want to try the identify the positive aspects and you want to train the child. Okay, no? That is very, very important. So this you can see in autism, in lower IQ, you can see whenever in autism you are having lower IQ and you are having seizures, the prognosis will be definitely poor. Okay, now suppose you are seeing 2 children with autism and the same therapist is giving the intervention. But when you are having epilepsy or mental retardation, severe and profound, the prognosis will be little poor when compared with only autism with any other comorbid conditions. And this is the semantic skills we say, that was I am discussing 10% of children with autism, you are having special skills. So even a normal individual cannot have that kind of skills, but 10% of children with autism, they have special skills in music, painting, singing, drawing, or artistic, or some other kind of things. And although autism may occur with some other kind of syndrome like Fragile X syndrome, neurofibromatosis, Angelman syndrome, Fragile X syndrome, all these things, okay, no? And 75 to 80% of cases, what we discuss is a hereditary causes. And many of the time I am telling you, comorbid like mental retardation, seizures, and brain damage, complications to the pregnancy, all these contribute to the autism. Generally engaged in autism, they are very good babies, and babies they may have sensory processing difficulties, and they are overexcited, fuzzy eaters, and they are crying. Some children with autism they cry, we don't know what happening because of the non-verbal cues. So when a normal child you ask, they can tell I am having pain here or I am having not well, some kind of thing. In the younger age, 4 to 5 years, they can communicate. But children, because of the lack of problem in the communication, they present like a temper tantrums or behavior or some kind of anxiety or some kind of thing. So when we take to the doctor who is not expert, they try to add on the medication. So that's the thing is you want to send for occupational therapists or you want to look over the pain concepts, you want to teach them the pain concepts, you want to educate the mother. So all these things you want to be doing. So there will be poor imitation in children with the autism, and there is abnormality in the eye contact. There is poor response to people, and you can see bland facial expressions. So like normal children, they are not having their psychomotor activity or facial expressions. You can see not much excited. They have bland facial expressions, and they have high tolerance to pain, cold, all the senses. All these things you can see. And there is joint attention. Joint attention, this is very, very important. The children with autism, they cannot share their interests with other and or objects with other children. So this is the poor joint attention you can see in autism. They are not able to share their interests or happiness or their objects with the other children. So they feel little insecure and also they have problems with the communication. And also this I think we can. So and this is a very common movement. So you can see this kind of behavior like hand flapping, pacing. They will be running very fast without not much motive, and they have unusual inspection. So if you give the toy, they will be seeing like this. Okay, no. And opening and shutting of the door like sameness, repetition, staring at the lights, attachment to the objects. So their resistance to change. This is very, very important. That I'm telling you that autism, when you want to change suddenly, it's very difficult to change the child behavior. It takes some time to understand why you want to change. So you try to prepare the child when there is sudden change in the daily routine of an autistic child. And you can see in some children with autism, they are very aggressive, they have social anxiety, they have self-injurious behavior and temper tantrums. And also very common features you can see is the sensory issues that our occupational therapy will be doing today. And also they have problems with the generalization, over selectivity and the splinter skills. So generalization. So the problems with the generalization is suppose a child with autism, you are learning a one concept in the school. So if the same concept again you are asking to do the child in the home in front of mother, the child cannot do. Again the next day you will be doing in front of the same teacher in the school. But the same task the child cannot able to do in the home or in front of the parents. So that is called as generalization. So autism children, so they try to learn in the same environment and they try to execute in the same environment. So because all these are because of the neurological issues or the challenges in the brain development or the complications. And also if you are asking a child with autistic children like to differentiate between a fork and a spoon, generally how do you differentiate? So generally we differentiate by the shape. Okay, no, this is having sharp edges, this is blunt. But autistic children, they have peculiar feature. They try to identify by color, like a tunnel vision. So these are the very challenging. So when we see both are having the same color, so it's a confusion for them. So what is fork, what is spoon? So these are the challenges and the neurological abnormalities at the higher level, neurological level, what we see in autism. And in the middle age, when they come into, say, as a child grows, when they come into the middlehood, you can see they are aloof, dull, passive. And also, but as a autism child, they grow into the adulthood and the middle childhood. What happens, these stereotypes and repetitive behaviors, they try to come down. In the younger age, you can see a lot of the stereotypes, the same behavior, closing and opening the door, or this obsession and compulsion. But the child is, when the child is aging, these obsessions and the stereotypic behavior will come down. And also you can see clumsiness in autism like ADHD also. They are carelessness in one thing, they will be falling down, hyperactivity. And also they have dyspraxias. Okay, no, they have delays in sitting, walking, and also they may have find it difficult in performing like jumping, other tying shoelaces, gross motor, fine motor when they are having the comorbid condition. And also they have problems with the tone, muscle tone. You can see hypotonia. And also sensory processing difficulties, joint laxity. You can see hyperextension of the joints and also over flexibility of the joints in some children with autism when they are associated with some kind of genetic disorders. Toe walking you can see in some children, but toe walking is not any compulsory indicator, but it's a very common finding you can see. Some children they have toe walking in the younger age, those who have diagnosed with autism. And also when they grow into the adults, they have problems with the language, and also they have some seek to develop social skills. They have increased anxiety, and they have low self-esteem when they grow into adults. And nearly 70% have failed to good language when you have given early identification and appropriate interventions. When they grow into adults, they try to go into the jobs, and also they are depend on the family for their residential setting. And also it depends on the comorbid condition like seizures, epilepsy, genetic disorders. So depending on the factors, they are depending on their family members. And there are other medical comorbidities also autism. So whenever the child with autism, there are very common complaints like eczema, itching, allergies. So autism children, they are high prone for asthma when compared with the normal children, and they have ear and respiratory infections, and they have abdominal pains, constipation, gastrointestinal problems. And also in autism, you can see there is a recent study shows there is a communication between brain and gut axis. Okay, no, the brain and gut axis. Suppose you are giving some food to the child with autism, like instead of gluten free, casein free, some kind of food you are giving where the child is not able to tolerate. You can see some kind of brain damage to the children, and also declining their behavior, performance, improvement, and also you can see some kind of behavior problems in children with autism. Nearly 40% of children, they have abnormal connections between the brain and gut. So that is brain gut axis connection. And also some children with autism, they have seizures, headache, migraine, all these things. And also when compared with other children, mortality is increased, particularly of the comorbid condition. So autism itself, they have normal lifespan like other children. But whenever you are having the comorbid conditions like epilepsy or profound MR, severe MR, or some other kind of genetic disorders, the lifespan is decreased in children with autism. But otherwise, they can have a normal lifespan when they are not having much comorbid condition. So these are the other behavior problems like they are easily frustrated, inattention, hyperactivity, irritability, anxious, harming self. All this. So the treatment approach, particularly it will be the multimodal approach. So that what we are doing at NIPID is a rehabilitation model. So it will be the behavior model, educational model, and the medical approach. So whenever the child with you are identifying child with autism, early intervention is very important. And also the medical measures will rule out MRI and EEG, all these things. And also the basic neurological examination, the urine test, blood test, and thyroid, all these things will be screening. So early identification is very important. So whenever as a healthcare professional or a parent you are identifying a child with autism, so early identification is very important. So how early you identify the child, so how early you are giving the intervention, that is more important. You can see that much improvement in the child. So that though you are identifying child after 10 years, 15 years, today you are knowing that your child is autism at 15 years, you can't see much improvement. So because all the neuroplasticity, brain maturation, brain development, CNS development, so everything will happen by this age. So if you are identifying by the first 5-6 years, ideally first 3 years is very crucial. Identifying and referring to the appropriate therapies like speech language therapies, occupational therapies, early intervention is physical therapies. Okay, no, and also the parallel with the same age children is very important. And there are also many misconceptions in the society. What we are doing, there are many doctors telling, or many faith healers, or some kind of RMP doctors, or some kind of therapy centers. They are telling those are commercial outside that your child autism is cured. I will make your child normal. So autism is never cured. Okay, no, it is a neurodevelopmental disorder. So what we are treating is the challenges that the child is having in autism and the comorbidities that the children is having in autism. And also we are improving the quality of life by identifying it in younger age. So we are mainstreaming them into like a normal children. So how much improvement when we are identifying at an younger age, we are giving appropriate interventions and we are training the parents, mothers or the other professionals, and we are giving training them and we are seeing lot of improvement in them. So that's why early identification is very important. There are no medications that cure autism. So what medication we are giving is only supportive medication for epilepsy, behavior problems or insomnia or some other kind of physical conditions we are giving. So early recognition is very important. And also not only treating the child with autism is not important, you want to counsel the parents and the caregivers. That is very important. So what is the condition, what are the symptoms, how their lives will be autism. So what are the challenges that child will have in autism. So not only treating the child and leaving is not important, training the mothers and supporting and giving caregiver. You can know any children with autism or ID or ADHD, they have a lot of caregiver burden. So addressing the caregiver burden is also very important. Unless the mother's health is very physical health and mental health is not in a good condition, they cannot take care of the child. So the mother and the caregiver health is also very important, both the mental health and physical health. So you should give equal importance when you are doing counseling or training session. Many mothers or parents, they are also having anxiety, depression or other comorbid mental health issues. So addressing that is also very plays a crucial role in treating the child with autism. And you should look for the coping strategies in a child with autism. Look for the support groups, create a WhatsApp groups or some NGOs you can tie up. You can share the material, or this is a child. You can say this is the interaction with other parents with the same disorder is very very important. So though as a doctors or professionals we are telling, sharing of your experience from the mothers of a children with autism is a good learning. So even we learn from the mothers and the challenges that the mothers are telling. Every time we read and upgrade, the mother will come and tell the new problem in other child. So we want to upgrade our knowledge. Though as a medical doctors or rehabilitation professionals, so everyone want to upgrade their knowledge on the autism and look for the dietary changes. So diet also works in autism, particularly these behavior problems and cognition and some other speech, but not for all. But nearly 40% research says, but in 40% of children with autism, diet also works, particularly this gluten-free and casein-free. So you ask them, the mothers, to stop for 2 to 3 months, like gluten-free and casein-free, and you want to follow. You are seeing any changes in a child with autism after stopping this diet. So if there is no changes, you can ask them to take all the diets. But if you are finding significant changes or some kind of improvement, you want to ask them to continue this gluten-free diet and casein-free diet. And also increasing age appropriate interest, build their skills in the areas of interest, expose them to the new opportunities. So as a parent, you should not think that my child cannot do. So you want to expose them to the new opportunities. You don't know where your child will shine or where your child has that kind of a skill. So expose to the new opportunity as far as possible. So based on that, you try to identify the new areas of interest where your child can fit enough or where he is having the talent or the skills in that. But approach these changes slowly. Suddenly within 1 week you should not. So slowly you want to implement these kind of changes or these kind of new kind of skills to the children with autism. And also there are other centers where they are like stem cell therapy. Recently, the National Medical Council or NCA of India, they banned stem cell therapy. So they are actually doing from the last 10 years this stem cell therapy and charging 5 lakhs. So they are taking the bone marrow blood cells, again they are infusing. When they are, for each session they are costing around 3 to 5 lakhs. There are many children who went, and there are some other parents. Stem cell therapy has no role in autism, like hyperbaric oxygen therapy, beamer therapy. So nothing is having no role in autism except early identification and intervention. So there are no medications, and medications we use only when there are comorbid conditions in autism. And autism has also a lot of impact on the family. So look about the family issues also. They have some parents ask for marriage. Sir, my child is having mental retardation. My child is having autism. Whether we can go for marriage? So they come for the genetic counseling. They come for the marital advice. Whether I can get married my child with autism. So all these things also you should try to address, and also the financial implication. So this is Temple Grandin, and no two children with autism are similar. So each child with autism is a specific child. Each intervention doesn't work for the same child. So whenever you are addressing each child, you should have different intervention depending on the child needs. So autism is a lifelong disorder. So these are the protective factors. So have children between 21 to 35, have regular antenatal checkups, try to avoid any teratogenic medication, avoid smoking and alcohol in pregnancy, and also speak to a doctor and go for genetic counseling if you are having any high risk factor. So these are the medical aspects. Very briefly, I talked about the medical aspects. Thank you very much.
So, dear participants, if you have any queries regarding medical aspects of autism, you can ask. Like participants who have joined online, also they can unmute their mic and ask questions. At last, we'll be having a discussion session. So those who anyone wants to ask any queries, you can.
Lost. Good afternoon, everyone. Our next speaker will be Dr. Ambadi. Assessment. He will be talking on assessment and identification of the autism.
So, once again, good afternoon to everyone. So, I'll be mainly focusing on the assessment aspects of autism spectrum disorders. So, I'm not going to give any introductory remarks regarding autism spectrum disorders because already Sir has given remarks on that. So, today we are going to discuss a brief about assessment aspects. So, I think first I have a question regarding assessment, particularly diagnosis of autism. So, as per our norms, like Government of India norms, what will be the assessment tool which we use for assessment of autism? Yes, ISA. So, what is ISA? Huh? So, Indian scale for assessment of autism. So, that is basically the scale which we use for diagnosis of autism, and based on the ISA scores, we will classify autistic children into different categories. So, other than ISA, what are the diagnosis instruments which we use for children with autism? So, mainly I will be focusing on the different diagnosis of autism, different types of diagnosis of autism, and as well as other than ISA, like what are the things which we are using globally for the diagnosis of autism. So, that will be the major focus of this presentation. So, when we talk about assessments, like diagnostic assessment of autism, we will be having majorly two types of assessment. One is indirect assessment, and the other aspect is like direct assessments. So, in indirect assessments, we will be using different questionnaires, interviews, rating scales to obtain data regarding the children with autism. So, that will be the major focus. How to get the data regarding the children with autism. It is not directly we are assessing. We are getting the data indirectly for getting the information about the child with autism to come to a conclusion that the child is having at risk of autism, or the child is having autism spectrum disorders, and to what extent. So, that will be the major focus of indirect assessment. So, the data regarding indirect assessment mainly focusing on children with autism in the very young age, like if it is at the age of 1 year or 2 years, we will be having mostly focusing on indirect assessment, because it is difficult to diagnose the child with a direct observation. And when it comes to direct assessment, what are the methods for a direct assessment? As we said, we use ISA for direct assessment. Like Indian scale of assessment of autism, we will use for assessment of children in a settings like clinical settings, which will observe the behavior of the children and find out that the child is having autism, comes under autism spectrum. So, what are the different indirect assessment tools? So, can you give any examples of indirect assessment tools? Some scales which we can use for. So, audience who are sleeping can. So, the audience who are online also can answer. So, no answers on this indirect assessment. So, we have different tools like for making observation regarding children with autism, because it is not just an unstructured observation. When we make indirect assessment, we will be having a structured observation about the child with autism. So, through that structured approach only, we will be able to gather the information regarding the children. So, for that structured assessment, for the indirect assessment, we have a scale called Gilliam Autism Rating Scale. It is like a widely accepted scale regarding indirect observation of autism, and it's used widely across the globe. And one thing, when it comes to indirect assessment, mainly we are gathering the information regarding the child from the caretaker. So, the caretaker will be giving the information about the child. Based on the information from the caretaker, we will be coming to a conclusion about whether the child is having at risk of autism. So through Gilliam Autism Rating Scale, GAS, we'll be getting an active autism quotient in which we'll be having a rating about autism. In that, there is a scoring pattern also. It is not like a indirect, unstructured observation. It is a structured observation. In this with this scale, that we will be able to observe the child and rate the behavior of the child through the observation which is given by the caretaker, mainly focusing on the caretaker. So that is one aspect regarding this Gilliam Autism rating scale. Then comes another rating scale is Asperger Syndrome Diagnostic Scale. That's another scale, ASDS. So ASDS is also like an ordinal scale which we rate the behavior of the child. And it's rated like a score of 90 or above, specified the child is likely or very likely to have Asperger syndrome. Then comes the Autism Diagnostic Interview, ADI. Autism Diagnostic Interview. It is like one of the popular tool and valid and reliable tool which is used for diagnosis of autism. And this gives us the complete picture about having the child with autism. So ADIR, Autism Diagnostic Interview, which help us to have a clear picture about the child is at the risk of autism, the child is having autism. So it is like a scale which we will administer with the help of caretaker. Data will be gathered directly and indirectly and come to a conclusion about the autistic child. And when it comes to direct assessments, there are other than ISA, there are other popular tools which we use for direct assessment of children. One is ADOS. What do you mean by ADOS? Any psychology students are here? What is ADOS? ADOS. It's one of the popular tool which is used globally. Like ADOS is a popular tool which is used globally in the sense it is used in almost all Western countries, and in some of the East Asian countries also they use this tool for the assessment of autism. It is a comprehensive assessment tool. It's like a autism diagnostic observation schedule, and it's ADOS itself. I used to see when ADOS we need 3 or 4 people to carry that ADOS bag itself, because that is a comprehensive assessment which we create an environment for the children to get assessed. That is one important aspect. So we create a naturalistic setting for the children to be assessed for diagnosis of autism. Then comes the another popular tool is CAS. What is CAS? Childhood Autism Rating Scale. So CAS is also even we are using CAS in our country also. We are using CAS for diagnosis of autism. Other than ISA, we use CAS also. So Childhood Autism Rating Scale. It's mainly used for finding out the severity of the children with autism. As in ISA, is also will get the severity of the child, whether the child is having mild autism or moderate autism, severe autism. So this information we will get from the scoring pattern in the ISA. Thus, like that, we will be having a scoring pattern in CAS, which will help us to get the severity of the children. And why we are doing assessment? So, what is the purpose of assessing children with autism? Identification and intervention. So the major purpose is like as per when we do assessment for children with special needs, we have a purpose that we have to develop goals and objectives for that children for program planning. So for program planning, we will be doing different types of assessment, and based on the assessment, we will come out with a strategy for intervention. So for that purpose, we will do assessment for children with autism also. And a major area which we focus on children with autism, mainly when we focus on children with high functioning autism, major area which we will focus is like social and cognitive proficiencies, verbal and non-verbal communication abilities, and adaptive skills. That is a major area rather than focusing on the, when we talk about children with intellectual disability, we used to focus mainly on functional skills of the children. So, for children with autism, they will be having deficits, as Shravan Reddy sir has rightly pointed out what are the symptoms of children with autism. So, they will be having major deficits in social and cognitive proficiencies. So, based on that, we will be making program planning for children with autism, and other major areas we will focus on behavioral interventions for children with autism spectrum disorders, and to generalize their competencies across multiple environments, because children with autism, their major deficit is in the socialization, social cognition. So when we want to improve their social cognition or socialization skills, the major hurdle a professional face is to generalize the skills. When we teach about the socialization skills, we should be able to make the child to generalize that skill. So generalization is a major problem which we face when we train children with autism. So that is a major purpose of doing assessment for children with autism. When it comes to principles of autism spectrum disorder assessment, first thing is that it should be developmentally based assessment. We should have an assessment which is mainly focusing on the developmental aspects of the children. So developmentally based assessment only will be giving an information regarding program planning. And then we should get a understanding about the child's strength and weakness across different developmental areas, focusing on the cognitive development, focusing on the socialization skills, focusing on the perceptual development. All these areas we should get a clear-cut idea about what has to be done or how we can proceed for program planning for that particular children. And one thing is that children profile of children with autism will be always heterogeneous. As in the previous presentation of Sir was talking about the main aspect is like no child is unique. Like everyone is unique. Not child is sorry. Everyone is unique in that aspect of when we consider a child with autism spectrum disorder. So we can't make a generalized approach in managing children with autism. So we should have individualized approach in managing children with autism. So it's based on the profile of the child, we should make decision regarding how to move forward for intervention of child. And assessment mainly focusing on multiple areas of functioning and recognize variability of skills. We should be able to recognize the variability of skills and recognize variability of behavior across settings and consider the impact of a social disability on behavior. So behavioral aspects, generally behavioral aspects will be given more focus when we diagnose or assess a child with autism spectrum disorders, and the program planning should include a behavioristic approach also. Most of the times when we give intervention for children with autism spectrum disorders in the early years, we will mainly focusing on therapeutic aspects by ignoring the educational as well as behavioral aspect of the child. So behavioral aspects and therapeutic, along with therapeutic aspects, we should have clear planning for psychoeducational assessment and psychoeducational planning for intervention for children with autism spectrum disorders. So that is one area which we should give focus. And along with this diagnosis or assessment, we should have a functional and adaptive behavior assessment aspect also should be given importance in that. One thing is that when it comes to psychoeducational assessment or functional assessment of children with autism, we don't have a comprehensive functional assessment instrument or a tool for in Indian context to assess about the psychoeducational profile of a child with autism. We generally adapt the tools which we have developed for children with intellectual disability. For example, generally when we ask about for program planning, what instrument you have used for program planning for child with autism, generally our students used to say we used basic MR for program planning of children with autism. One thing is that we are adapting that instruments for the purpose of program planning for autism spectrum disorders, because in Indian context we don't have a standardized or a popular tool which we can use for psychoeducational assessment. And always we have to maintain a developmental profile for diagnosis or assessment of children with autism. And what are the testing accommodations which we should give for while we diagnose or assess the children with autism? Most of the times we will be assessing the children with autism in a clinical settings. We don't go for assessment of a child in a naturalistic setting. Always we go for in a clinical setting. So what are the testing accommodations which we can give for children with autism? So the core deficit of autism can significantly impact test performance. They will be having problems with the socialization, communication skills. They will be having repetitive behaviors. So all those problematic conditions they will exhibit when we start assessing children with autism. So for overcoming that issues, how we will be able to give some accommodations for that. So based on the level of the child, based on the approach which we give for the child, different assessment instruments also we have to make choice on different assessment instruments for assessment of autism, like impairments in communication, always having difficulty to respond to verbal test items, or understanding the directions that accompany non-verbal tests. So this is one major area which we feel difficulty in assessing the child. Then social relations, they will be having problems with social cognition. So when we want to assess a child with having severe problems in social cognition, they will be having problems in establishing necessary joint attention. So that is another issue which we face while doing the assessment for children with autism. Then, so always the examiners or the people who are doing assessment for children with autism must constantly assess the degree to which the test being used reflect the symptoms of autism and not the specific targeted abilities. Always we will be having a targeted ability to assess. That is the major thing which we, for example, when we assess a child with intellectual disability for certification purpose and all, we will be going for IQ assessment. So our purpose is that ability to be assessed, when to be assessed, how to be assessed, and where to be assessed. That considerations we will not give any kind of consideration for that aspect. Rather than that, our purpose is that we want to find out the IQ of that child. So in a whatever way which we are comfortable, we will be able to, or we will proceed in that way, rather than considering the accommodation for that particular child. So this is one challenge while making assessment for children with autism. And each child is unique, as we stated. Each child is unique and it is heterogeneous population. And based on the uniqueness of the child, we should make accommodations for assessment. And there is no one set of accommodations that will work for every student with autism. Each student is unique, and we should have an approach based on uniqueness of the child for assessment, and it should be always specific accommodation to meet the student's individual needs. Accommodation should be based on the individual needs of the child. And first, we should prepare the child for testing experience. When we start doing assessment, first we should prepare the child for testing experience. Instead of preparing the child for testing experience, what we will do is like, as a professional, what we will do is that our purpose is that we have to just find out whether the child is having autism or not. We don't think about from the child's perspective what the child will feel, and instead of developing a rapport with the child, we'll directly go with the assessment procedures. So this all things comes out with a challenge in coming out with a pseudo diagnosis. That also will be there. Sometimes a child will not respond if child doesn't like him. like the professional. If the child professional fails to develop rapport with the child, this all is a creates problems in proper diagnosis of the child, and making clear program planning also, because if we are not able to particularly when it comes to psychoeducational assessment or psychoeducational preparing a psychoeducational profile, if we are not able to create a able to assess it properly, we will not be able to prepare the program or intervention program properly. So that is one aspect. So first we have to prepare the student for texting experience, and the place the testing session in students' daily schedule. That is one another thing. So it should be in a naturalistic setting rather than in a clinical atmosphere, and minimize distractions, and make use of pre-established physical structures and work systems. Make use of powerful external rewards. So that is one aspect, powerful external rewards. Then carefully pre-select task difficulty. One thing when we do assessment and all, particularly when it comes to intelligence testing and all, what we do is like we'll be having items in a sequential order, and most of the professionals will go in that sequence only. They will not think about the perspective of the child. For example, if a child is interested in solving the mathematical puzzles, we can go with the mathematical puzzles first, doing assessment or testing for mathematical puzzles, so that it will be interesting for the child, and child will get motivated to participate in the testing situation. So that is based on the interest of the child, and based on the we have to select the difficulty also based on the child's profile or the child's interest. So that is which we should consider while doing the assessment. And modify test administration and allow non-standardized responses also. This aspect which we consider while we started developing the indicators of intelligence. We had a standardized response for each and every item which we are expecting. So what we in the final stage, what we decided that we have to collect the verbatim for each and every response, and from the verbatim response which we get, we will conclude that what could be the standardized response. It is not like that a professional discusses, or a group of professional discusses and come to a conclusion that this will be the response. It will be the way the children respond. So that should be also considered. For example, if we ask about some verbal questions and all, based on the culture, based on the way which they have been exposed, they will be giving responses, but the meaning will be same, but the way they respond will be different. So that is one aspect when we do the test administration we have to consider. So that the testing accommodation should be considered. Then regarding behavioral observation of the child, always it's a heterogeneous group of children, and it is not unusual for them to display a range of behavioral symptoms including hyperactivity, short attention span, impulsivity, aggressiveness, self-injurious behavior, temper tantrums. These all behavioral issues they used to exhibit while even with a professional also. When we do start assessing, they will exhibit this kind of behavioral things. So that behavioral observations we have to clearly note about the behavioral observations, and observation in a typical environment also will also facilitate the evaluation of test taking behavior. So how we can come to a conclusion in which environment we should be able to test the children. So that conclusion we will be able to make based on the observation of the student in a typical environment. In different environments, how they are behaving, and whether they are exhibiting these problems in different situations or in a different areas. So this aspect should be considered. Then, and observation of the test taking behavior may also help to document core features of autism. So when we test the child, what are the behaviors the child is exhibiting, and we will be able to make the decision regarding the behavior or features of autism by observing the way the child is being tested, and the test taking behavior matters. And I will just go through a glimpse about different assessment instruments which is used globally, other than which we are using in Indian context. So for choice of assessment instruments is based on child's level of verbal abilities. If it is a child is verbal, based on that we have to make choice of assessment instruments. And if the child is ability to respond complex instructions and social expectations, based on that we will be ability, then ability to work rapidly, the ability to cope with the transitions during test activities. Then in general, children with autism will often perform best when assessed the test that requires less social engagement and verbal mediation. So this is something. And so I'm just going to give about a different test which we can use. For a functional and adaptive behavior assessment, we can use Brigham's inventory for early development. That is one instrument. Then early learning accomplishment profiles. Then scales of independent behavior device. Then AIDD adaptive behavior scale. Learning accomplishments profile. Developmental play assessment instrument. Then for social functioning, as we popularly use VSMS, VSMS are the popularly used tool which we use now also. Even it is developed in 1935, still we use VSMS. But even VSMS they have adapted, came out with a different revised version also. Like now we have Vineland 3, that is popularly known as Vineland Adaptive Behavior Scales, WAPS. So WAPS is the instrument which we can use for finding out the social functioning of the child. Then scales for independent behavior device, so that is another instrument. Then and for about the social functioning, we will be getting information regarding preschool curriculum assessment that contains social subscales. Then Batley developmental inventory, learning accomplishment profile, then Michigan scales, assessment evaluation and programming system. So these are the assessment instruments for social assessment. Then for language functioning, one thing is that for children with autism spectrum disorders, for assessing language functioning, we don't have a specific scale in Indian context. We use generally assessment instruments for children with intellectual disability for assessing the language component. So for language component, we have Peabody picture vocabulary test. Then expressive one-word picture vocabulary test is there. Then for academic achievement of students with autism spectrum disorders, we have very limited resources in our context. In our context, even if we say straightly, we don't have any academic achievement assessment tool for specifically for children with autism in our context. We don't have a psychoeducational profile instrument or any other academic achievement scale. We always use basic MR or MDBS for assessment for the children with autism also. And the most popular academic achievement instruments which we use globally, even it is available in India also, like PSN is giving that instrument, that Woodcock Johnson test for achievement and Wessler individual achievement test will be the appropriate tools for academic achievement of children with autism. If anyone needs the recommendation for each area of program planning, you can consult me. I will give this presentation. Because of time limit, I am going to just. So, one thing is that we generally now focus on early identification and intervention. That is a major focus area which we have for assessment of autism, and we have a cross disability approach, and as a part of increasing prevalence of autism spectrum disorders, we can say develop increasing prevalence of autism spectrum disorders has been come to a greater extent, and because of that, everyone started considering about the early intervention aspects. Earlier, we were not giving much focus on early intervention. but in the last 5 years or last 10 years, there has been a tremendous shift in giving early intervention for children with development disability, mainly development disabilities. As a part of that, the number of early intervention centers in the country has increased. Even the Ministry of Social Justice has come out with close disability early intervention centers in different parts of the country, and now through National Health Mission, they are establishing district early intervention centers and all. So this all gives us like the need, what in what way this condition of autism spectrum should be approached, and the awareness among the people also has increased about autism spectrum disorders. So for assessment, we should have clear planning for a diagnosis and assessment, which will only help us to have a proper intervention approach in and that intervention only leads to like fruitful development of children with autism spectrum disorders. So always this, whenever I give a presentation on autism, the slide will be there. It is not misbehaving. I have autism. Please be understanding. If you have any queries, you can ask. No queries? So I think like online participants, offline participants are also sleepy. They are autistic. So we should be able to understand them. So I think I will conclude my session. So next I invite Dr. Kanjan Singh. So Madam will be able to give about the therapeutic intervention, that we will focusing on how occupational therapy is important and in what way occupational therapy helps for early intervention of children with autism spectrum disorder. So I welcome Dr. Kanjan Singh.
Good afternoon, everyone. Good afternoon, everyone. So my topic is occupational therapy and sensory integration in autism. So what is the role of occupational therapy, especially with the children with neurological disorders, in activities of daily living, and to make the person or the child with neurological disorder, to make them independent in their activities of daily living. So what is the actual role of occupational therapists with the person with neurological disorders? Occupational therapists work with children of neurological disorders in the areas of developmental and motor performance to improve their fine motor skills, activities of daily living, eye-hand coordination, self-help skills, then play skills, thinking skills, visual skills, sensory skills. Also to maintain their proper posture, posture controlling, positioning, then range of motion, and to improve their strength and endurance. So what OT checks with the sensory motor components regarding muscle tone, then muscle strength, muscle endurance, range of motion, coordination and balance, posture and hand functions. So especially generally with the child with autism, the children with autism, they may have hypotonic, low muscle tone or floppy muscle tone. So to improve their muscle strength, to improve their muscle endurance, coordination, and hand functions. So occupational therapy assessment in autism in the areas of gross motor skills, fine motor skills, oral motor skills, play skills, cognitive skills, perceptual, sensory issues, skills in activities of daily living, and in academic skills. So in perception, what are the perceptions? Visual perception, auditory perception, sense of touch, spatial perception, sensations of position, and body balance. The child with autism, they may have sensory integration issues. So in sensory integration issues, the child may have difficulty with the visual perception, he may have difficulties with the auditory perception, or the child or the person may have he may be hypersensitive or hyposensitive to the stimulation. The child may be hypersensitive to auditory perception, visual perception, or he may be hyposensitive. There are two conditions. The child may be hypo or hyper. If the child is resisting for any stimulation, for auditory stimulation, touch stimulation, visual stimulation, it means the child is hypersensitive. If the child seeks that stimulation again and again, it means the child is hyposensitive. Then what are the cognitive and perceptual skills? Attention and concentration, orientation about the place and person, arousal level. Arousal level means activity level. Then concepts formation, figure ground perception, body schema, planning and organization, and problem solving. So what is sensory integration? Generally the children or person with autism, they have the problems with the sensory integration. So what is sensory integration? Sensory integration is a process by which people register, modulate, discriminate the sensations received through sensory systems to produce purposeful adaptive behaviors in response to the environment. Then why it is important? Because sensory integration is a process by which we receive information from our surroundings with our senses. We organize this information and we use it as to participate in our day-to-day skills. So this is the diagram for the sensory integration. Integration among the all the senses like tactile, sight, sound, taste, smell, touch, balance, and body position. Then what is sensory processing disorder? If the child is having difficulty in sensory processing, it is called as sensory processing disorder. So sensory processing disorder is characterized by difficulty in detecting, modulating, and integrating sensations adaptively, which causes difficulty in daily living. Dysfunction of sensory discrimination, vestibular processing disorders, and praxis disorders. So what is sensory modulation disorder? It refers to the tendency of system to generate responses that are appropriately graded to the incoming sensory stimuli rather than over or under reacting to them. Just now I told the child may be hypersensitive or hyposensitive. So these are the features of sensory processing disorders. Tactile defensiveness. If the child is hypersensitive to any particular tactile stimuli, like child is resisting to touch any wet things, sticky things, child is resisting to wear any clothes, rough textured clothes, it means the child is tactile defensiveness. Then gravitational insecurity means if the child has fear of like sitting on the swing, on the park activities, even the child is he has fear to climb stairs, climb down the stairs. It is gravitational insecurity. Then aversive response to the movement. If the child is responding in an averse response, in the reverse action, if the child is becoming suddenly irritated, is screaming, it means the child is responding in an aversive movement. Then sensory dormancy. These disorders are mainly characterized by negative reactions to hugs and touch experiences. If any child is registering to touch by others, hugs by others, he may become irritated. He will push any other person or the child. So this is negative reactions to hugs and touch experiences. Then difficulty standing in line. It is a gravitational insecurity. Dislike of messy play. It is an example of tactile defensiveness. Hard time with hygienic routines. Again, it is tactile defensiveness. Car sickness and dislike of the swing. These are the examples of gravitational insecurity. Then what is dysfunction of sensory discrimination? It refers to involving inefficient and inaccurate organization of sensory information. This dysfunction caused due to central processing error results from difficulty in perceiving spatial and temporal relationships among stimuli. The child is having difficulty in discriminations among the sensations. If the child is sitting in the classroom and he's looking at the teacher. Teacher is teaching them. So the teacher is giving the lesson. The child is getting confused between he is looking at the picture or he is listening to the teacher. So he is having difficulty in discriminating the sensations. Then vestibular processing disorder. It refers to the disorders resulting from imbalance among excitatory and inhibitory vestibular mechanisms. Praxis. So what is praxis? The clinical signs associated to this type of disorders include hypotonia, poor proximal joint stability, poor writing and equilibrium reactions, and deficient bilateral integration and sequencing. Because of the hypotone, because of the incoordination, because of poor sitting tolerance, poor hand coordination, poor sequencing concepts, the child may have dyspraxia. Dyspraxia means if the child is not able to do any action, if the child is not able to learn any new action, any new activity. For example, if we want to teach the child for brushing independently, the action is difficult. The dyspraxia, the child may have dyspraxia because he is having hypotonic, so he is not able to move his hand properly. He is having poor joint stability. So because of this, he may have dyspraxia. So what is the actually dyspraxia? Dyspraxia is defined as difficulty in planning and carrying out skilled, non-habitual motor acts in correct sequence, caused due to deficient action plan. This disorder is caused by clumsiness, poor transition, preference for stereotypes, and excessive delay in activities of daily living. Because of the poor muscle tone, because of incoordination, because of hypotone, the child may show clumsinesses in actions. He is not able to follow the correct sequences in the actions, and because of this, he is having the deficient action plan. So he will show some clumsinesses in actions, awkwardness in the actions, and poor transitioning problem. And then because of this, the child may prefer the stereotyped behavior, the same activities, the same actions, and in what activity he is mastered, he wants to do the same activity. He is not willing to learn any new activity. So he may prefer for the stereotype. Then because of this, the child may have excessive delay in activities of daily living. So what are the components of praxia? Ideation means what to do, planning and organization, and execution. What are the symptoms or signs of sensory processing disorders? The child doesn't respond to his or her name call. The child does not make eye contact with persons or the objects. Poor sitting tolerance, poor functional attention, poor functional communication. Flapping of the hands, tapping objects. The child may or may not have poor muscle tone. Hypersensitive or hyposensitive to tactile stimulation. Hypersensitive or hyposensitive to vestibular stimulation or touch and stimulation, sound or light stimulations. So the child may have difficulty with the changes or transitions in the movements or the activities. The child may have poor social interaction. Some children may have behavior issues like throwing objects, pinching self or others, and screaming. What are the behavior issues associated with autism? Because of the sensory processing disorders, impairments in functional communication, impairments in social interaction, person with autism manifests following behavioral issues: aggression by pushing, hitting, spitting, screaming or throwing. Then may show repetitive behaviors like tapping with the objects or tapping on the floor, hand flapping, fidgets, spinning, jumping or running. Then head banging, body rocking, hurting self or others. These are the types of sensory processing disorders. The types of sensory processing disorders are sensory modulation disorder, sensory based motor disorders, and sensory discrimination disorders. Sensory modulation disorders means the child is hyposensitive or hyposensitive. Sensory based motor disorder, because of the hypotone, because of the incoordination, child may show dyspraxia. He is not able to learn new skills. He will not show interest in learning new activities. This is sensory based motor disorder. Then sensory discrimination disorder. The child is not able to discriminate between the visual stimulation, learning auditory stimulation or tactile stimulation. So sensory motion disorders, over responsive or under responsive. Then discrimination disorders among visual stimuli, auditory, olfactory, gustatory, proprioceptive means sense of body position, vestibular means balancing, tactile means touch, and interoception. Interoception means inner feelings like the feeling of hunger, expression of hunger and thirst. Our children with autism, a person with autism, they do not express their hunger and thirst. They are not able to show their body pains. So this is interoception. Then sensory-based motor disorder, dyspraxia and postural disorders. Because of the hypotone, because of the toe walking, the child may have some postural disorders. The child may have deformities in the spine. Yeah, the child may get ankle tightness. So these are the other names for dyspraxia. So the role of occupational therapists is in improving the learning skills. The role of occupational therapy in learning skills is to provide good fine motor skills, free writing skills, visuomotor skills, eye-hand coordination and proper pencil grip. To improve finger dexterity function also, and to improve learning skills in a play group activity. These are the play interventions. The goal of OTs in play intervention is to provide a person with an opportunity to participate in play activities, because the child with or the person with autism, they have the poor social interaction. So in play group activities, we can improve their social interaction with other children. We can improve the concept of waiting and the concept of sequencing and turn taking concepts. It improves learning and practicing a variety of social, motor and functional skills. So what are the sensory integration activities? Vestibular activities like bouncing on the ball, then swinging by using flat swing or tire swing or disc swing, then spinning. Tactile activities like play with the Play-Doh, brushing or massaging by using different texture scrubbers, massages, then by using electrical body massager. These are the tactile activities. Then oral motor activities like if the child is not able to blow whistle, he is not able to suck with the straw, he is not able to speak out during brushing time. So we can give them oral motor activities by using straw and chewy tube. Then what are the proprioceptive activities like pushing and pulling activities, pushing heavy objects, pulling heavy objects, then tug of war, then stretching of the bands, lifting or carrying heavy objects from one place to another. These are all the examples of proprioceptive activities. So how we can improve vestibular stimulation? What we can improve with the vestibular stimulation? Vestibular stimulation improves body balance, gross motor skills like physical abilities, visuomotor skills. It reduces impulsivity and hyperactivity, regulate consciousness and attention level. It improves motor planning and action. It improves motor coordination, sitting tolerance and cognitive skills. We give vestibular stimulation by using therapy balls. We give vestibular stimulation by using park activities like swing, slide, then tunnel we can use for vestibular stimulation. So these are some examples of vestibular tools like slides, rocking chair, then therapy ball, trampoline for jumping, balance beam for while walking. Then here the child is on the blue color ball. This is a vestibular stimulation on the therapy ball, and the child is getting joint compression to improve his joint stability, and also he is getting passive stretching. He is getting exercises to improve his muscle tone. These are some examples for the proprioceptive activities like push-up activities, carrying and lifting heavy weights and objects, then climbing, pushing, pulling, and bouncing with the ball. These are some examples for the oral motor activities like blowing bubbles, blowing balloon, sucking with the straw, then use of chewy tube, use of loop straws to improve their sucking ability, and also the use of vibratory massager, toothbrush, vibratory or electric toothbrush. If the child is having oral issue, the child is not able to chew food properly, the child is not able to spit during brush time, so we can suggest the parents to use battery toothbrush to improve their muscle tone and also to get the massage to the inner muscles of the oral area. So this is a naturalistic settings play-based approach. If we are encouraging children to coordinate or to interact with the play group activities, so we are improving. We will improve their sensory skills, we will improve their motor skills like gross motor and fine motor, we will improve their social interaction and also the behavior, proper behavior in social context. Calming folder in school setup, in the classroom setup. The child is sitting, the child with autism sitting in the classroom, he needs a break in between. So what type of breaks he needs? He may need a calming folder like we can give them massage with a therapy ball, we can give them some beans, seeds to sorting, we can give them some their favorite activities to distract his mind. If the child is getting overloaded with the sensory stimulation like in the classroom, he's sitting in the classroom, so because of the information, continuous instructions from the teacher, it will be overloaded, sensory will be overloaded. So So to relieve him, to give him a break, we can use sensory stimulation material. Like sensory balls we can use, we can give them a break in a park activities. So these are the sensory materials what we can use in a sensory room, in a school setup or in inclusive schools. Tunnel we can use for crawling, then rocking chair, therapy ball, then hammock swing, flat swing and trampoline. Our children in school setup, they compulsorily need a break at least after 15 to 20 minutes, because they are not able to sit at one place for half an hour or 45 minutes. They need a break. So for their break, we can give them a short break with all these activities. Then the child is saying here, I need a break. I need a break with trampoline, with play-doh activities, then bean sensory bag, then weighted backpack. This weighted backpack we can use to improve their sitting tolerance and proprioception. Some people, they use ankle weights to improve, to avoid the toe walking of the child. Then weighted blanket also we can use to improve their sitting tolerance and proprioception. Then here is the iPad. If the child is non-verbal, if you want to say I want this, so we can use iPad. So child can choose his choice by showing to the object. I want play. I want play activity, like I want trampoline. I want gym ball. I want swing. So for that purpose, we can use iPad. So this is the play assessment. How we can assess the play. If the child is alone, he is sitting alone. So this is an unoccupied play. Solitary play is an example of children with autism. Onlooker means the child is looking while the other children are playing. Parallel way means the one child is doing the same way the other child is also trying to do the action or activity like other children. Associative means they are playing along with the other children, and cooperative means the same activity they are playing together. So play and behavior therapy is also very important for the children with autism. Play therapy is often used for the children since they are not likely to sit on a couch or recall their dreams, engage in traditional talk therapy. So we can use play therapy. Play therapy, there are two types of play therapies, like direct to play therapy, non-direct to play therapy. Direct to play therapy, where the therapist is giving instructions, the therapist is choosing the activity for the child. And non-direct to play therapy means the child is getting his choice of play therapy. So in direct to play therapy, our goal is to improve his sitting tolerance, attention, hand coordination, and following the instructions. In non-direct to play therapy, we can find out, we can assess the child performance level. How he is playing with the toy, how he is playing with the activity. It is a constructive or a destructive. Is he playing in a proper way with the toy or not? Is he making eye contact with the object, or he is having a distraction with other material? How much is understanding level? So we can assess about the comprehension skills, understanding skills, cognitive skills of the child with the non-directive play therapy. So this is a reinforcement board to improve their sitting tolerance, to improve their skills in making them independent in activities of daily living or in the classroom setup. To give any skill, so to complete the task of writing, we can use the reinforcement charts. And this is a visual for brushing. I have given one example. Such type of visuals we can use for making the child to become independent in these self-help skills. So we can use visuals for brushing, bathing, then toilet time. This is one example. In the visuals, the steps are subdivided. Yeah, it is very easy for the steps. So to understand the child very easily, and he can follow these steps one by one. So initially he may need the verbal instructions from the parents. Okay, you follow these steps, first step, second step, third step. So after some repetition, the child will become independent for following all the steps. He will look at the steps, he will follow the steps, and he will do his brushing skill, ADL skills independently with the help of these visuals. This is a visual for how we can teach the good behavior and bad behavior, because most of the children are children with autism. Some of them are they can understand verbal commands properly, and some of them understand visual commands properly. So if the child is good in verbal commands, it is okay. If the child is not understanding the verbal commands, we can use the visuals. So visuals for good behavior and bad behavior, like pushing others is a bad behavior. We can show it is in the picture. So the child can understand, okay, it is a bad behavior. Okay, thank you so much. So the next session will be taken by Srinivas sir. He is the HOD in the speech therapy department. So I am handing over to the Srinivas sir.
Good afternoon, everyone. As the time is around 20-25 minutes, I thought that I will talk about some general problems in communication, speech and language, and maybe some tips on how to train communication in persons with autism. And maybe also, if time permits, how we should communicate with persons with autism, what kind of care we have to take when we are actually communicating with them so that they can respond to us well. So let us first go into the disorders that you see commonly in persons having autism. So straight away I'm going into autism because already earlier speakers must have told what is autism, and also I'm not going into those details now. Now, one important thing which is again important for diagnosing autism is language, abnormal language or delayed language development. In fact, the triad for diagnosing autism, they say that language abnormalities, social interaction, and then stereotypical behaviors. These three are the main pillars for diagnosing autism. So, out of this, if you take, I say that one and a half of this is to do with language. In fact, social interaction also requires communication. So, I say that social interaction is also part of your language development as well as such language. So, these two are very, very important for diagnosing autism. So that is one important thing that, and there is a typical kind of language that is happening in autistic children or the persons having autism. A typical problems will be there in autism, which we'll be discussing in future slides or even in this slide also. Then one important thing is that these children or these persons do not have any interest in communicating with human beings, other human beings. So disinterest in communication with other people or even disinterest in meaningful exchange with other people. Lack of interest in human beings' voice, even mother's voice also they will not bother to actually respond to. For them, initially even mother is an object which is taking care of fulfilling their needs. Once the needs are fulfilled, they may not bother about mother's also. In fact, I sometimes ask the parents who come, I try to inquire, as infants or maybe as children who are below 1 year, how the behavior was with them. Like usually parents say that even if they go off, the child doesn't cry. Normally, a child should be crying if the mother is not there. Child with autism may not respond like that. So he is not bothered whether mother is there or not. Once the needs are fulfilled, they may not bother till the need is again the thing for them. And then you see that they have better responses for environmental noises, mechanical noises kind of things than human being speech or voices and all. So human interaction they lack, but they do interact very well with other things like object, mechanical things, toys and all. And then another important feature or the thing that you diagnose autism is eye contact, lack of eye contact. And eye contact is again one of the prerequisites for communication. Unless you look at the person, you may not be able to really initiate your communication, you may not start talking to them or using gestures with them, and you may not even receive the information that they are trying to send you. So eye contact is also one major issue with children having autism or persons having autism, if it is not trained properly. Then disinterest even in pointing to things. Pointing is the primitive way of communication in human beings. A typically developing child, normally developing child will start actually pointing and using it for communication at the age of around 9th month or so. By this age, the child is able to understand what others speak to them. They can even recognize certain objects by name. And when they want something, the simplest way is just point to that and that is met. So like for example, the child wants fan, the child may point to fan and may say, and the mother may understand that it wants fan, so the mother may switch on the fan. So initially, this is actually called as, there is a technical term, lexical development, development of pointing. That is the primitive way of communication, and this is not seen in children having autism. And then echolalia, this is another typicality of autism speech. Like echolalia is there even in other children also who are developing language, but it may be there for some time and may wane off, go off. But in these children, it typically persists. And in fact, in echolalia, there are 3 types of echolalias that are seen in these children. We call them as immediate echolalia, where immediately when you say something, the child may repeat back. Echolalia is actually parrot-like repetitions, repeating whatever they hear. And then delayed echolalia, where after a certain amount of time, the child may go on repeating what you said to the child. And mitigated echolalia, that is altering the utterances that you are using and trying to again imitate them, trying to repeat them. So this is one typical thing that happens with a person having autism. And then they can very easily learn words that refer to objects than that refer to people or emotions, feelings and all. So when we say that, as a rule, when you are training the communication, start with maybe names of the objects and mechanical things, and from there you go towards human relations and all. That's how they get confidence that they are able to communicate those things. So slowly we can shift their attention towards using human relations and all. And then faster learning of concrete words than abstract words. So concrete words, I think many of you may understand that concrete words are those which you can see, feel, which is easy to understand, whereas abstract kind of words require imagination, certain amount of language and thinking. So these people can very easily develop concrete words, but they may have problems with abstract ideas. Then they use, even if they learn certain words, they may use them in restricted context, with restricted environments. And then they lack understanding of relation between words. Even if you are using 2-word phrases, 3-word phrases, they may not understand how they are related. Like for example, I gave a example there in the brackets which says understanding relation between needle and thread. So they may not understand that you have to use thread with the needle and then put that into the needle and so on. And then this is another important thing, that is metaphorical use of language. That is literally taking the meaning. For example, the child had done something, somebody may just pat the child and may say good. This child with autism may come and complain to you that he is trying to, that uncle is knocking me down, pushing me down. So taking it literally, that is what is called as metaphorical use of language. This is typical to children having autism. And then another important thing is neologism, that is inventing or coining new words. This happens even with us also, but we generalize them more. But these children, each child may form his own new word. He may have communicative value to that, he may have certain meaning to that, but we may not understand it, so we may not be able to communicate using those kind of words with them. So neologism is another important typical thing that happens with children having autism. Neologism is making new words or inventing new words and all. And then reversal of pronouns. This is another typical thing that happens with autism. Sometimes I say that maybe because adults are communicating like that with them, so they are again, because of echolalia, they just repeat it. For example, mother may ask, some mothers may ask, do you want to eat food? So this child may just say, when he wants food, he may say, you want to eat food. So this is reversal of pronouns. Like instead of saying, I want to eat food, he may say, you want to eat food. Or sometimes some mothers even do this. So I do counsel them. Like if his name is, let us say, maybe Abhilash. The mother may say, does Abhilash wants to eat food? So this child also, when he wants food, he says Abhilash wants to eat food. So we should not make, usually with autism especially, what we should do is, we should say those sentences which we want them to say back. Like for example, I want food, Say I want food 10 times with him in the situation, and then maybe once you can use, do you want to eat food? This actually helps in making them to get the right response at the right context and all. And then if they speak sentences, they may use very simple sentences, short sentences, and they may have problems even in using right word order in the sentence. That is actually grammatical construction may not be possible in them. They may not use proper grammatical structures in the sentences. And you see that they many times omit certain grammatical features like auxiliaries, plural markers, and then conjunctions, prepositions. These kind of missing elements will be there in their sentences. Unless you specifically train them in using them, they may not be able to use them properly. And then use of inappropriate language, which is inappropriate to the time, place, and person. This is another typical thing that happens with autism language. So they don't use whatever they learn as per the context, as per the person who is there in front of them, as per the time where they are living in. So these kind of problems will be there in them. And then they will have a lot of pragmatic problems. We call them as pragmatics, that is to how to use language. Once you learn words or sentences, how you are supposed to use. Here I emphasize something like topic maintenance because they have a lot of problems in using language. But along with topic maintenance, they may not be able to stick to the topic when they start conversing with you. They may have problems even in initiating conversation, may have problems in maintaining the topic in the conversation, may have problems in how to end the conversation and so on. So this is another thing that happens with them. And then, so these are some of the, okay, so those are some of the problems that you can see in the communication of people having autism. Now we'll see what should be the approach to really train communication of people who are having autism. I try to actually give a kind of a common kind of an approach here, but each child is unique, and based on the assessment results of the child, we do a lot of assessment in communication, like starting from whether he is able to move his structures which are important for producing speech sounds, starting from lips to lungs, and also various other hand movements, hand gestures, all these kind of things we may assess, as well as even assess their processing skills and all. So depending on the ability of the child, you may have to select the mode of communication to be trained, and also see what kind of strategies or techniques you can use for training children having autism. So here I am trying to give actually a common kind of an approach, but again, this has to be used carefully based on the assessment information that is there in the child. So it's not necessary that every child should be given exercises for the oral peripheral mechanism and all. Depending on whether the child has problem in movement of those structures or not, you should decide. So the first major group is cognitive training. A lot of these children have problems in processing. Cognitive abilities are affected. So one is attention control. You must have seen a lot of autistic children where there is problem in attention. Many will have, some may not have problem in attention, but many will show problems in attention. So you may have to start from training their attention. And from there, only when you attend to the stimuli, how are you receiving the stimulus? Using all your senses. I call them as input channels to the body. So I'm seeing a thing, I'm listening to something, I'm feeling something, I'm smelling something, I'm tasting something. So through these senses, I'm trying to receive information about my external world. Once I pay attention to that stimulus, then I can concentrate on that and then receive that properly. Only when I receive that properly, I can analyze that properly and also use it properly when I want it. So attention is a crucial thing. So if we feel that the child is having problem in attention span, we should train the child to be attentive to stimuli. So that again here you may talk about in terms of, actually I'll be discussing that in the next one, but you may talk in terms of training their auditory attention, visual attention, tactile attention and so on, depending on the problem they present to you. Then you may have to work on concept formation. Even though they may understand certain words, even though they may understand certain meanings, still their vocabulary may not be complete, their concepts may not be complete. So we need to check what concepts are not there in them, what meanings are not developed in them, and then maybe accordingly we have to train those concepts. And to concept, again, different activities could be there to really work on concepts. I'm not going to those details because our time doesn't permit for that. Then symbolic understanding. Symbolic understanding is again, see, communication is actually through symbols. In fact, we are using a term like symbol because the symbol that I am using to denote a meaning doesn't have any one-to-one relation between the meaning and the symbol. For example, why should I call animal dog as dog? Is there any connection between that sound dog and the animal dog? There is no connection at all. If I call dog as Bobo, there is some connection because the dog is making a sound like Bobo. I am calling it as Bobo. So there is some connection. This is what happens initially when the children are learning communication, learning speech. But we adults tell them, no, you should not call it as Bobo, you should call it as dog. That's how people call. So slowly he starts actually using a word like Bobo, he starts using a symbol like dog. So that's why they are called as symbols. So there is no one-to-one connection or relation to that symbol you are using and the meaning that you are expressing. So the child has to understand that these symbols can stand for something. For example, the best way of working on symbolic understanding is using play. For example, let us say it's quite common for the children to play with all those items that are there in the kitchen. Whether it is a male child or a female child, they may actually start using a broomstick, may insist on giving a broomstick, take a broomstick and start sweeping the floor. Okay, but initially they want the broomstick. Only when you give the broom, they use it for play. After a certain time, they may start using any branch of the tree, any stick they find, and may start using it as broomstick. That means what? Is the stick the real broom? It's a symbol, symbolic representation of the real thing. So they understand that I can use anything to show that I am doing this activity. And after some more time, they may not insist on any stick and all. They may just use a kind of a gesture, holding the broom, using a gesture. This is also a symbol. Okay, so best way is to work on play. Through play, you can establish symbolic understanding, which will be very useful for language development. Then, if the child is having problems in sensory skills or motor skills, then you may have to work on them accordingly. Like if you feel that the child is having problems in auditory attention span or auditory skills or differentiations, discriminations, then you may have to work on those things. And if you feel that the child is having problems in visual skill development, you may have to work on those things. Tactile skill development, you may have to work on those things. And then certain children with autism have clumsiness in the oral muscles and all. They may not be moving their oral muscles properly. So there, we may have to go for actually advising even certain exercises for the oral mechanism. Like the Miss Kanchan had actually talked about certain gadgets and all to be used. She was even showing some pictures there. So all these are used actually to stimulate the oral peripheral mechanism, which are important for your vegetative skills. When I say vegetative skills, maybe for your spitting, eating and all. And also the same skills are important for producing speech sounds. If these muscles are not working properly, you cannot use them for proper speech production. So you must work on those things, provided the child has problems in that. If the child is not having problems, we need not worry about that. It's not necessary that every child with autism must have problems in these oral peripheral mechanisms. Certain children may have, so you may have to do that there. So that's why your assessment is very important. If you do proper assessment, you will know what kind of disabilities are there in the child, so that you can accordingly plan your training program. And then environmental enrichment. This is another important thing. Many times what happens, you ask the mothers of the child having autism, you ask her, how do you understand that your child wants food? The stock reply is that mother says, my child goes into the kitchen, stands in front of the kitchen stand, because he knows that this food and all are there on the kitchen stand. So mother understands, okay, this fellow is standing here, so he wants food, so she may just give food. So there is no opportunity for the child to really come out with the word and ask for it. If you are doing it off automatically, even we may not communicate if everything is met as per time. Anyhow, the child is in one way communicating by standing there in front of the kitchen stand. But again, there is something called as efficiency of communication. For example, let us say, today only had a case where the mother said that, how do you understand that your child wants food? Mother says that he keeps the finger like this. When he keeps the finger like this, understand that he wants food. I asked her whether your husband understands it. She said no. Why? Because we cannot understand why the child is doing this. Because mother got conditioned to this, mother is attending to that need. So this is not having any efficiency for communication. Instead of this, if I can make the child to do this, everybody can understand, right? Not only mother, father, but even we can understand. If we are there, mother is not there in front of the child. If we are there, we may attend to the child and then provide some food to the child. So this is what is efficiency of communication. So we have to see whether the child's communication is having efficiency or not, whether he can communicate using them with everyone or not, at least with many people, so that the life of the child is easy. So these kind of things we have to take. So you have to provide opportunity for the child to communicate. You have to show a way of communication to the child, as well as you should allow the child to feel the need for communication. Every day, let us say, I have a habit of having a cup of tea around 11 o'clock. If the canteen person comes and serves me tea at 11 o'clock, there is no need for me to talk to anyone. And one day if he doesn't come at 11 o'clock, I wait up to 11:15, 11:30, he doesn't come, then I may pick up the phone, call him and ask him to serve me tea. So he is creating a need for me to communicate because I am feeling that I must have. I am feeling hungry or I am craving for tea or whatever it is. So you have to provide need, you have to provide opportunity, you have to show a way for communication. This is what is mainly important in the stimulation of speech and language for the child. And then you may have to work on receptive language and expressive language. Receptive language is to make the person to understand whatever you are speaking or whatever you are signing. It may be gestures also. I need to understand gestures also. If I am using speech, the person should be able to understand speech also. So you may work on receptive language as well as expressive language, wherein you have to, in receptive language, if you say, you may have to work on maybe association of symbols or words or phrases, sentences and so on with the proper concepts or activities. And if you are interested in working on speech communication, you may have to work on imitation of speech sounds, and from there to syllables, from there to words, phrases, sentences and so on. And also you have to take care of entire linguistic abilities enhancement. Like in linguistics is actually a field which studies the language structure and all. So these are all linguistic terms like vocabulary, syntax, semantics. So I need to work on improving concepts, improving meanings in the brain. I need to work on making the child to produce different speech sounds of the language. I need to work on making the child to form proper words in the language. Each language has its own rules. For example, in English, if you take this particular thing is called as mic. If I use an abbreviated form, MIC. If I say sign or kind, do you understand? No, because I am jumbling the sounds. So there is a certain rule in this language that I must first use M and then I and then C, so that, or maybe Ka, when you are saying it is Ka. So mic, when I say, you can understand it as microphone. So like this, every language has its own morphological rules. What kind of order of sounds forms a meaningful word in that particular language. So the child has to learn that system and then understand how to form sentences. What should be the word order in the sentence? Sentence is a group of words, but again, as per a specific order. If I don't follow the order of that language, it doesn't make any sense to you, in spite of understanding all the words which I am trying to tell you. So that is what we call as grammar simply. So all these things the child has to understand so that he can use them to communicate properly. So this is a common kind of an approach I am telling you. Again, provided you do proper assessment of the child for communication, you can implement this program. Then now let us see what are the specific concerns that you have for persons having autism and especially language intervention. There are certain issues that are there with these children, so I am trying to just talk about those things. Like one is attention, already we have discussed. Eye contact, this is another major issue, where many times you may require to use physical or manual manipulation to really improve eye contact. For example, you ask the child to look at you, he may not look at you. Then you may have to hold his head and try to make him to look into your eyes. These children typically, if you hold the head, he may not open the eyes, he may close the eyes. Then if you open the eyes forcibly also, he may not look you, he will be just looking up. He tries to avoid looking at your eyes, into your eyes. So here it starts. And maybe you wait for some time. Possible that the child may just have a glimpse at you. The moment the child is giving a glimpse, leave him. So slowly when you do this, he understands, okay, if I look at this person at least once, he will leave me. Because he doesn't want us to restrict him, he may do that. And slowly we can increase the time taken for this also. So that slowly we improve that. I'm just telling a primitive way of working on eye contact, but it should be worked in a systematic way. So eye contact also many times we may have to work on, especially children who are having problem with like autism. Then you may have to work on vocal responses again. That is, I just said that you have to make the child imitate speech sounds and all. It's not so easy as said. So I may have to give him physical and visual clues. Like for example, I am saying papa, papa. How am I making a sound like pa? Maybe I have to show him that I have to combine the lips to say pa. Or maybe I have to use a mirror to give him feedback to make him to understand that he's supposed to put the lips together and apply pressure to say a sound like pa. Or maybe I may make him to place his hand on his throat so that he can feel the vibrations at the vocal cord level, so that he understands that if I vibrate my vocal cords, a sound will be generated, and then if I close my lips, a sound like pa will come. Once he starts doing it, he'll enjoy doing it because he feels that he has achieved something, so he may continue to do that. So I'm just starting from a simple sound here, but from there we may have to even go for syllables, words, and so on. So imitation. So for vocal responses, sometimes we may have to use visual clues and then physical manipulation also. And then training words and phrases or the different elements of languages. For this, always try to use, this is true with any child, use real things first, real objects first, and then go for other kind of pictorial symbol. Because, for example, let us say you are having a book with you where I have my own restrictions, like in a page I can print maybe 6 pictures or 8 pictures. So I have dimensions. Elephant is there, rat is there, mouse. Elephant, I concise the size of elephant and print. Rat, I may little expand also sometimes and put it there. Now, the child has seen rat at home. He knows how rat looks like. He never saw elephant. Now, I am showing the picture of elephant and telling him that this is elephant. What will be his concept? He may start thinking that even elephant is also of the size of rat. When will he understand that? Only when he sees real elephant, he will understand. So, maybe if it is elephant, tiger kind of things, maybe you make it a point at least, take him to zoo and show him those things once at least and then go back to picture. So, always, especially in children having autism, if you use real objects, real animals and all, it will be easy for them to form proper concepts and learn them. So, always, this is true with even other disabilities also. So, always start with the real things, natural things, and then go for pictorial stimuli. And then, with these children especially, once you make him to understand a particular word in a particular context, try to use that with variety of context, because these children have problems in generalizing things. So you must immediately work on actually using that in different contexts so that he doesn't have problems in generalization of that particular word that he has learned. Then, pronoun reversals is another issue. Already I did mention that. Here, instead of working on expression of the child, for example, the child is saying, you want milk, instead of saying, I want milk. If you just ask him to just repeat, no, you should not say you say I, it may not help him. So what you have to do is, you have to make him to understand why he should use I, why it is not you. So work on comprehension and not on expression there for pronoun reversals, and then that will actually make you successful in establishing them in them. And then for echolalia is just repeating whatever they have heard. If there is no connection to the context in whatever they are saying, don't respond to that. Never ignore it. If you pay attention to that, it may increase also sometimes. So ignore that if there is no connection to the context. If there is connection to the context, try to provide that meaning. For example, just now the child has finished eating food and father has come home. He is having his food. And this child comes and starts saying, I want food, I want food, I want food. That is why this is the echolalic utterance that he is doing. You know that he has already eaten. But because he is saying that there is connection to the context there, get the food and try to feed him. He cannot take it because already his stomach is full. Then he will understand, if I use it wrongly, that thing will come to me, so I should not use it. So he will stop using it in that context. So, if it is not as per the context, if there is no relation to the context, ignore it. If there is relation to that context as such, whatever equivalent is there, try to provide that meaning to the child. Then, now, how to speak to these children when you are training communication, or even when you are actually instructing them for other kind of activities also, how to talk to them, how to communicate with them. One is always be positive with them, especially children having autism. Because you need to praise them, you need to reinforce them. And be specific when you are praising. For example, I gave an example there. For example, you asked him to wash his hands, he went and washed his hands. Just saying good boy will not help. You tell him that you did a good job, you wash your hands. Why you are saying good boy? Because you wash your hands. If you do this job, I will say good. If you don't do this job, I will not say good. That you will understand. And always teach them to listen. Many times, we may not bother about this. So, again, to make a person to listen, we may have to actually use a particular thing repeatedly. But again, if you over repeat it, if you repeat it many times, that may actually, again, they may be aversive to whatever you are saying. So, take care of not over repeating whatever you are saying. And when you are repeating something and if they are not able to understand, then try to use visual clues, physical manipulation to make them to understand them, to make them to listen to them. Then know what you want the person to do. You first have to be clear what you want him to do. And also you be clear whether he can do that or not. For example, if you know that he is very much afraid that he doesn't want to jump from the, let us say, that wall, and you make him to stand on that wall and ask him jump, 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 will not help you at all. But be sure that he can do that job. So always expect him to do or instruct him whatever he can. So from there the positive kind of thing will start with the child. So be clear in your mind what you want the child to do and then make a reasonable request that he can do. Then give adequate information about whatever you are trying to train them or teach them. Like tell the child in advance what is going to happen next. Especially this is true with children having autism. If you tell them what they are expected to do, even in the classroom also, if they know what they are supposed to do, they will do it very fast. Otherwise, they will have problem. For example, Ms. Kanchan was showing a chart when I was seeing the presentation that for brushing also she was having different pictures there. So what you should do first, what should do next, and so on. So this kind of thing will help children having autism. So you have to maybe make your schedule with pictures and all, or sequence all those activities that he is supposed to do. Like for example, he is not supposed to do exercise for 10 minutes. After that, he is supposed to eat his breakfast. After that, he is supposed to sit and do yoga. After that, he is supposed to do something else. So all that, if you with pictures and all, if you schedule it and tell him that you are supposed to do this, you are supposed to do this, you are supposed to do this, it's very easy for them to actually understand as well as perform them. If you just use only verbal instructions, they may not understand everything of what you are saying and they may have problems in really responding to them. Then use simple, clear and concise language. Always try to make it concise, simple words, simple sentences, and try to talk to them so that they can understand easily. And also tell what to do and not what not to do. This is very important, especially with children having autism. Like, for example, he is throwing food on the floor. If you just say don't throw food, no, it's not going to help you. Tell him, pick up the food and put it in the sink. This is what he is supposed to do. So tell what to do, not what not to do. This is a principle, a rule that should be used with children having autism when you are communicating with them. Then be as neutral as possible while giving instructions. Okay. So don't unnecessarily threaten them or don't challenge them. That will actually make them aversive. And that's where you may even see a lot of behavioral problems also cropping up in them. They may even hit you sometimes if he doesn't like it. So don't challenge them. Don't use threats and all. State plainly what they are supposed to do. That's all. Then avoid asking questions. If they are asking questions that have choice, like for example, I want him to now take bath. This is the time for bath. I should always say, let us go for bath. Not that, do you want to take bath? No, there is no other choice for him. He may say, I want to play. That is not the time for him. So, if there is no choice, Don't ask for choice. Be specific in what you are communicating with them. Then, this is important again with these children. Labeling feelings. So whatever feelings are there, you try to label them because they are very poor in understanding feelings. They don't show emotions. So unless you label and keep on repeatedly telling them what it means, they may not understand the emotions. Once you start labeling and all, they may slowly start actually responding to different emotions of the other human beings and all, and their own emotions also. Many children, mothers say that my child doesn't tell even if it is painful to him, because they are not able to express their emotions and all. So we have to actually help them in that. Okay, so labeling helps in gaining information, and then understanding also improves. And then avoid labeling people. Again, here when we say people, labeling him. Like for example, don't work on self-image of the person. Don't attack it. You always be positive with them. And then avoid reprimands. Reprimands also actually make a person to have problems. And then also avoid threats. Don't threaten. Okay. So these are some of the simple things that you can use when you are actually communicating with children having autism. So I'm sticking to my time and finishing it. Maybe I think if there is any question I'll take. Otherwise, maybe when they have a panel discussion, they may talk about those things. Any specific question anybody has? I know that half of the people have already left. They're just walking off. That should be taken seriously afterwards. Attendance you take at the last also, you take attendance. Huh? Oh, let it be.
So thank you, Srinivas sir. So next we have a session on psychological aspects of autism by Dr. Sunitha Devi, our wonderful colleague. She will be talking about psychological aspects of autism. I think Sunitha ma'am's first talk after joining over here. So we are so excited to hear you. So welcome, Sunitha ma'am.
Thank you. I need a warm welcome. First off, thank you so much. So, psychological aspects of autism, and for the past 3-4 days, we are celebrating Vishwa Swalita Divas, that is autism. And what are the psychological aspects? Because not only the medical, biological, and other aspects we take care of autism, children with autism here, we also look for how we can enhance their self-esteem, how we can reduce their anxiety, and what kind of anxiety they go through, and what kind of psychological difficulties they go through. So as a human being, I always say the most beautiful part of your body is the mind. So please do take care. And with autism, as we say, that there are 3 main features which we have like deficits in: your socialization, your communication, and we have restrictive behaviors and repetitive behaviors. So how these affect our functioning? You must have gone through your day-to-day life experience. It's not necessarily that you have to be having the autism in order to understand how does it feel when someone is not acknowledging you. You know, if you are talking to a person who is wearing the specs, who is wearing the glasses, you know, you feel uncomfortable. Can anyone tell me why they feel uncomfortable? Because there is no eye contact. So when you are talking to a child with autism, they do not have that eye contact on all. So with that, it is a spiral kind of thing, because they are having deficiencies at that, and the person who are dealing with them also, because they do not get acknowledgement, they do not get like captured or looked upon, so they also avoid. You must have experienced that when you are talking to someone and they are not acknowledging you, you will not like to talk to that person again. Yes or no? You know, so this kind of things happens with people with autism, and that creates lots of anxiety as well as self-esteem issues, because it's not that they don't want to talk to you, they want to talk, but they are not able to. So we have to understand the difference between what they want and what they are not able to. So if you understand this difficulty, then definitely when you are dealing with them, you will be more patient, you will be more accepting of their deficits, and you'll be working how I can enhance or how can I interact with them. So when we talk about psychological aspects, there are different theories and models for autism. We need to understand in order to make the recommendations, suggestions, and the dealing. So intervention part. So psychological theories and model for autism explain the underlying psychological process of autism, which means social functioning. And as a human beings, you must have experienced yourself during COVID. We were in the comfort of our home, but still we were not comfortable. We were dying to come out and deal, see other people. So that's the importance of human being in your life, right? So people with autism have the difficulty in the social functioning. So just imagine how difficult it would be for them to not be with people, or people are not talking and accepting them and interacting with them, and they have stereotyped and repetitive behavior patterns and all. So suppose if you are doing some repetitive behaviors over a time, you get bored, so when I speak to some of the students, they say, ma'am, what we are doing the same thing, you stop enjoying that. But these children have that limitation that they enjoy the same thing again and again. And definitely language and communication, which sir has already spoken about how we can enhance. So there are theories by Barron and Cohen which are mentioning that empathizing and systematizing theory, which suggests that people with autism may have difficulty in empathizing. So again, there's a different statement that they may have this empathizing, but they are not able to communicate. If they are not able to show that they are also get affected with your pain, your difficulties, it does not mean that they are not feeling. They may be feeling but not able to express that to you. So empathizing is recognizing for understanding other people's emotions and reacting appropriately. So as they have the difficulty in communication, they will not be able to express that I'm feeling pained by your pain. And this problem leads to difficulty in making friends and interacting. Many times even parents say that I feel so bad because you get hurt, you get tired, and my child even does not come and say that, oh mama, you must be feeling this, because this is the normal expectations which we have from the relationship with our children and other people in our social communication and social interaction. So because they are not able to understand and communicate the feeling part, they may lack friends and interacting. And just imagine, put yourself that you are not having friends. How does life become? So you don't have people to share, you don't have people to help you and all. Life becomes very boring and very difficult. So this also creates lots of loneliness and anxiety in children or people with autism. So people with autism also tend to be drawn to things with the rules and systems because they really work with the systems regular, and that's why we say if they have the structure in their life, it is very good. If you want to change something from one thing to another thing, you make them accustomed to that change, or may prepare them mentally with that change, because that help them to make the transition. Because it is not easy for them to make that transition from one activity to another activity, one classroom to another classroom, or one place to another place. Therefore, people with autism have a low empathizing and high systematizing profile. So maybe may not be very good with the language and other subjects, but they may be very good with the maths, physics, technology, where they have to work with the things and not the people, because they have the main deficient area working with people. And there are some theories and models which also explains why people with autism tend to understand language literally. So when I say there was one child and he was crying outside sitting under the tree, and he was just pulling the tree out of, root. So the child was crying. So one gentleman came and then said, what are you doing? So this child said, my mother asked me to bring the people tree, So, and he was pulling the people tree from the root. So the gentleman said that it is not that actually you have to take the people tree home, you have to just take a branch and then you go. So children with autism have the difficulty in understanding the sarcasm, understanding the idioms and black humor and all. They take the things very literal. And this is a study by Happy in 1994 investigated how people with autism interpret non-literal speech by having them read a story containing irony and then asking questions about it. So they are not able to make the interpretation part. So this is one of the example where you can understand how difficult it is for them to make the interpretation of a non-literal language. So Anita's mother gives her dinner, but Anita does not say thank you or even look away from the TV. Anita's mother says, well, that's very nice, and that's what I call politeness. They were asked. So many of the times you must have experienced that now people when they go and they do not say thank you, it feels so bad. You say how impolite the person is. You know, you feel bad. So these people are not able to say and express that yes, I'm thankful that you have given me or you have done this thing to me. So is what Anita's mother said true? Or why did Anita's mother say that? So while people with autism could detect it wasn't true, they could not state why she could have been saying it. Example, to joke around or teach Anita a lesson. Okay, so for them it is very difficult to express their need sometimes and their willingness of playing with them or maybe with them. And there are other three cognitive theories of autism which explains their difficulties. They have the difficulty in executive dysfunction and weak central coherence. I will explain one by one, and then theory of mind. The first explains the social characteristics of autism, while the later two describe the known social characteristics of autism. So when we say social characteristics, where the interaction with people includes, so executive functions are basically your mental capacity to organize your thoughts and action to meet goals. Suppose if you are talking to someone, so you automatically organize the answers which you are expected to give, or you are expected to answer that question. So you already organize that. It is the cognitive process we use to control our behaviors also. So people have the inhibitions. We know in this particular social situation what we are supposed to do, what we are not supposed to do. Here we have come for the social wedding. We should not, crack jokes inappropriately, or we have come for the mourning of someone's death. We should not, behave inappropriately. But for the children with autism have difficulty in these organizing the thoughts and understanding the social situation. So executive functions include the mental capability needed to complete and shift between tasks and think of new things. And that's why these children have, they are more engaged with the same and repetitive behavior and the repetitive activities, because they are lacking the, or they are having the deficits in executive functioning. Then we have theories of autism where weak central coherence. So when we say central coherence, when we are looking here in this auditorium, I am perceiving this as a whole, Gestalt theory. You know, everyone, you all are there, but still I am able to perceive as a complete room filled with people, individual parts. Whereas children with autism are focusing only on the local part, only on one part, and that's why they are not able to make a story, because they just focus on one word or maybe one line and not able to comprehend the complete situation or complete conversation. For example, if confronted with many buildings centralized in one area of map, a person engaged in global processing would understand it was a city. Whereas children with autism have the local processing, and they will see one shop or maybe one pole or maybe one road. So they are finding the difficulty in making the central coherence of the situation or the sentences. So this weak central coherence can explain the narrow focus on specific interests and adherence to the familiar routines, because they only focus on the local part, so it's difficult for them to understand the bigger picture and have the more interest areas. And this may not matter to neurotypical persons but can cause extreme anxiety in autistic person, because our life requires different kind of people interacting with them, different situations, sometimes many new situations and new people. So children with autism have lots of difficulty with the changing the situation and meeting with new people. It creates lots of anxiety in them. So what could be the solution or suggestions? That whenever you are introducing some new concept, new interest, new situation, always prepare them mentally beforehand. So local processing in people with autism could cause issues with the task that a neurotypical person would have no problem with, that is combining separate sentences to form a coherent story. However, local processing in people with autism could also cause them to have advantages over neurotypicals too by helping them perform some tasks better. So every situation, every person, and everything has both the sides, positive as well as the negative. So we have to see what they can do rather than what they cannot do. So the same deficit where they have the weak coherence processing, you can utilize this as a strength also. So how you can use as a strength, that they can perform similar task in a much better way than a normal, typically growing person. Picking out defects in items on a production line in a factory. So if you just work on that, that can be their strength. Then we have a theory of mind, where they have investigated the reason why children with autism have misunderstanding about the social situation. They cannot put themselves in other people's shoes, as we have discussed, empathizing. They cannot, they are also unaware others have different feelings, thoughts and knowledge and beliefs from them. And that's why the word called swellinta. Swelling means engaged in themselves so much that they are not able to connect with other people's and other people's feelings. Understanding false belief is vital to understand others' thoughts and beliefs. This is often referred to as theory of mind, and where we have the mirror neuron image. So if you're very happy, you want to share that, oh, I got a gold medal and I need to share. But when you see someone else is going through with the pain and difficulty, immediately you will have this understanding and you will control your happiness and you will act accordingly. Yes, but whereas children with autism will not be able to understand that. They will be only engrossed by their own happiness and feelings and thoughts, and that's why they will not be able to connect with other people. So theory of mind is about perceiving other people's mental states, belief, intentions, feelings, etc. Whereas the children with or people with autism have difficulty with theory of mind, which is often linked to them thinking literally, and that's why they are not able to take non-literal meaning of the language, leading to difficulties understanding non-literal speech, sarcasm, irony, or any kind of humor. So people with autism want to be alone when they feel overwhelmed by others, because that creates lots of pressure on their limited resources of thinking. So that also characterize introverts, and we just label them, they are introvert, they don't want to. It's not that they don't want to, but they are not able to. So those who prefer their own company and do not put themselves forward in social situation, because that creates anxiety, that creates lot of mental stress, because that is not there with you. For example, simply you can just take our situation, like I'm a non-Telugu person, and if you put me in a GS where I have to deal with a person who speaks Telugu, after 1 hour of session, I get very tired, because I have to constantly work on the words, and I struggle to share my feelings, my thoughts and my ideas to the other person. The same thing is happening with the person with the autism, right? Because they are not able to have those connection with other persons, so it literally creates lots of anxiety and stress among them. Another supposedly autistic behavior which makes it difficult to separate what is going on from typical human variation is not seeking support or comfort from others. So whenever you are struggled with some situation or pain, immediately you go to your mother, you go to your sister, or you go to your friend and you share that this is going on, this is something I'm struggling with, just let me. But these children are not able to ask for that help. So they get overwhelmed by their difficulties, pain and all. So that also characterized mavericks and other independent spirits. Engaging in repetitive behavior that the autistic person finds comforting or calming is something we all do, and we are creatures of habit and become cliche because for so many of us it is true that our habits, our repetitive behaviors give us comfort. So they keep on doing their repetitive behaviors because it is comfortable for them. And we also, as normal, typical growing people, get into our comfort zone. Why? Because that creates a sense of knowing, sense of belongingness or sense of comfort. So you don't want to come out of that comfort zone. The same way children with autism or people with autism have the comfort zone. So it really creates pressure and anxiety when they have to deal with the social situation. Some children with autism or people with autism find change deeply upsetting, so always prepare them beforehand. Another symptom of autism is sensitivity to noise. It is not a psychological issue, but it is a sensory issue. But we have to see that how your sensory issue can affect the psychological relationship with other people. Okay, and because when they are sensitive to noise or light, they can make some sound, they can get very hyper, and that can create lots of unrest in the family, unrest in the situation as well. Which of us has not been in an environment that we find distressing because it is too loud or too quiet for my liking? So we all face that, but children with autism face it more often than a normal, typical growing because we know what we have to do in that particular situation. They are not able to think those novel ideas and interest areas where they can deal with that. Anyone who achieves at an extraordinary level is highly focused on that passion, hobby, or areas of expertise, and that can also characterize autism. So, in people with autism, anxiety is usually related to sensory issues like a reaction to loud noises or things out of everyday life. And for many others, primarily people suffering from high functioning autism, anxiety basically comes from the social awareness that they are different. You know, that people are not accepting them, that people are looking with the judgment. And it's not that they do not have the comprehension, they do understand. So, when you are dealing or when you are going in a situation and you find yourself dressed in a very like suppose there is a party and the theme is blue or black and you are in some other, so immediately you become so conscious of yourself. You know, the same way the child with autism becomes very conscious of self because they know that I'm not able to interacting, other people are not accepting and they are looking in a different gaze, and that makes them again it's a a vicious cycle and spiral thing, one leads to another. And lastly, I would like to say that all kids need a little help, a little hope, and someone who believes in them. So, as we have seen that they have the areas where they have the deficit, but you can use their deficit as a strength. You know, so if you are using their deficit as a strength, they can you can reduce their anxiety, you can enhance their self-esteem, you can work on their comfort level where psychologically safe they feel in the environment to interact and come and share, maybe not verbally but they can have their own gestures to show that they are comfortable with you. So you have to just find out what they are good at and just focus on that and reinforce. And as Srinivasa was rightly saying that we have to sometimes ignore the negative behavior because many times unknowingly we reinforce negative behaviors, negative communication, echolalia and other things. So we have to focus on and reinforce the positive behavior and their strength rather than what they are not good at. And thank you so much for paying attention. And there needs to be a lot more emphasis on what a child can do rather than what he cannot do. So it's basically shifting your focus. So once you start shifting your focus from what you cannot do to what you can do, you can increase your self-esteem, which is very, very important because if you do not believe what you can do, no one can help you to achieve that thing. So it's very, very important to work on their anxiety, their self-esteem, their comfort level. And when you start shifting the focus, usually I ask one question. Suppose there is a small line. You cannot touch that line and you have to make it like small. How will you make it small? You cannot touch, you cannot erase. There is one line. You cannot erase that. You cannot touch that. What will you do? So mostly immediately I get the answer that make a bigger line, you know. So that's the same thing you have to do. So if whatever is lacking, you don't have to focus on that. Whatever they have, you know. So if you start focusing on their positive strength and their positive behaviors, what they are doing it, the negative behavior will automatically goes down. So you don't have to work much on that. So once you shift the focus, everything will be shifted. So just see where do you focus, and whatever you focus, that will increase. So if you start focusing on deficit, those will increase. If you start focusing on the positives, that will increase. Thank you so much. I hope I was within the time limits and I was not too fast. And if you have any queries, we can have during the panel session. Thank you, sir. Thank you, everyone.
Thank you so much, ma'am. Thank you for this wonderful session. So, I think we are coming to the last session of the day, and after that we will be having a panel discussion of 15 minutes. So, I invite Yogavadi for having session on visual aspects of autism, and Mr. Yogavadi is a special educator in Cross Disability Elevation Intervention Center. So she is a special educator from the field of visual disabilities. Welcome, ma'am.
Good evening. So, I am going to talk about commonly known visual behaviors in children with autistic spectrum disorder. As you have already seen a lot about autistic spectrum disorder, what are its characteristic features, I am going to go about the role of vision. So, everyone already knows why vision is very important. We learn as a child, we learn from our senses, and more than 80% of the information we get from our vision. So, vision helps us in understanding our environment, interacting with it, and it also helps explore what are the objects around us. And when you go to school, it helps with reading, writing, and other skills, or even daily living skills like eating, brushing, everything. And it also finally results in social interaction skills, because you have to see the other person's facial expressions, understand, recognize, and reciprocate it. So these are the early signs of visual challenges in children with autism. So avoiding eye contact and delayed development of pointing and gesturing, then difficulty in following moving objects. If there is too much light or if there is less light, name response is poor, and preferring to look at objects rather than interacting with people, and repetitive behaviors, visual stimming. Now you may think that how is not responding to a name a visual challenge. See what happens when you call someone's name. They have to listen to it, hearing sense. Then they have to locate it, auditory localization. Which direction is it coming from? Then they have to shift their attention from that what they are doing to the particular direction. So there is shift of attention. So this is how it is a visual challenge. So now we are going to see how visual processing is different for children with autistic spectrum disorder. So first is, as Sunita ma'am said, they have weak central coherence, or they focus on details rather than the picture. So this can be a problem when you have to say, for example, I am asking you to read a paragraph. You are able to read word by word easily. Then I am asking you how much time it will take for you to copy this page. For that you need to see the whole page, not individual letters. They will have problems in seeing picture as a whole. Or if you show a picture and ask them how many people are there, they will focus on individual people, but may make mistakes in counting the number of people, total number of people. Next is difficulty with integrating visual information. So when you get information from different sources, for example, now I'm in the auditorium, I am seeing the lights, then there is fan, so there are multiple senses involved. If I let's say if I am reading something, I have to make sense of the written word visually, and I am also reading it aloud. I have to associate with the sound also. If I am touching something, my tactile, my skin is interacting with the object. The blanket is soft, the blanket is rough. my skin tells me, and I also see it visually. So these are informations we get through our senses separately. But when it is separate, it doesn't make much meaning. You have to integrate all the information you get and make meaning of it. So autistic children might have difficulty with integrating all these data together and making a whole meaning of it. So which makes it difficult for them to plan motor activities, coordination, and social communication. Next is peripheral perception. So when you talk about vision, we can roughly classify it into central vision and peripheral vision. Some children, when they feel that the light is too much or the visual stimuli is overwhelming, so they close their eyes. They don't close their eyes completely, but they narrow it into a slit, and they keep seeing like that. So it is a self-regulatory technique. They want to minimize the amount of light entering their eyes. So this helps them become calm. But what happens is that this is an obstacle when it comes to identifying objects or faces, because you have to use your central vision to read or to identify objects or to see faces, recognize faces. Hence, they also have difficulty in maintaining eye contact or understanding others' facial expressions. If you have trouble understanding others' facial expressions, then imitating those facial expressions may also become a problem. Next is called saccades. Saccades means nothing but movement of eyes. When I am reading or when I am scanning something, my eyes are moving from one object to another. So, some research studies show that children with autism have slower saccades and they are less accurate. So, if I am reading a sentence like this is an auditorium, I read this is and then I skip the word and, or I say this is auditorium, because my movement is not accurate or my movement is slower. So this also becomes a barrier for joint attention. Joint attention is this when a mother or anyone else points to something, the child should be able to attend to the pointed object along with the other person. That is joint attention. So children with autism have difficulty with joint attention because of this slower saccades. Next is two streams hypothesis. Two streams hypothesis says that when in our brain, apart from the visual cortex, there is two visual pathways: dorsal pathway and ventral pathway. The first is ventral pathway. Ventral pathway, another name is what pathway. As the name says, what means identifying. What is it? What if I am seeing an object? What is it? Identifying the face, identifying if it is big or small, what color it is, is it rough, is it small, is it big, like that. So this is responsible for identification. Next is where pathway. Where is visual spatial awareness. So relating relationship between objects in space, which direction, is it far, is it near, judging distances comes under dorsal pathway, that is where pathway. So if you are giving a child something, the child should be able to see the object, judge how much distance between the object and the child, and then reach for it. So children with autism in research has shown that they have weak dorsal stream and strong ventral stream. Dorsal stream means weaker in visual spatial awareness. So they have problem with visual tracking, motion perception, or orienting themselves to different directions. But since they have stronger ventral stream, that is stronger identification, they have good visual memory. That is why if you want to teach a autistic child something, not all children are same, but most children do better when you give them visual supports. They do better when they see and remember. Their visual memory is generally good. So now I am going to talk about a tool called Vibe 8. So as the name says, it is a questionnaire containing 8 questions. It is actually specifically used for assessing visual behavior in children with autistic spectrum disorder. So what happens is that the questions do not assess any percentage, mild, moderate, or anything. It is just to gauge what is the child having, what domain is the child having issue with. What do we need to concentrate on? So there is no pass or fail in this, there is no percentage in this. So these are the 8 questions. And the answers to this are always, often, rarely, never, not applicable. The first question is, if the child is obsessed with the object visually, if the child keeps staring at it. Then the second one is using side eyes, the child keeps looking to the side. And the third one is, if the child is doing some work, but something happens in the side, peripheral vision, the child is easily distracted. And when the child is walking, the child is not able to just use their vision, they also use their hands to trail the wall. And some repetitive behaviors, stimming, visual stimming, such as spinning objects or rocking hands in front of their face. And if the child is also sensory avoiding visual sense, such as the child likes chewing, sounds, other senses, but not using vision. And the child doesn't give eye contact when you're talking to the child, looks away, because the child feels it is overwhelming to see the face and listen to you. That is difficulty with integrating both information. And the last is, when you are trying to ask the child to do something, the child is not responding, the child is not seeing, the child only sees when he wants to. So visual avoidance. These are the 8 questions created by Dr. Rachel Piling. So it is available for free on the internet. And interventions based on the answers is also available on the website. It is called Make It Easier to See. Next is general intervention. So first is visual schedule and checklist. Visual schedule is nothing but a timetable with pictures. So usually in schools they have first hour English, second hour Telugu. Like that we have on particular time what I have to do. Similarly, you can have a daily visual schedule. First, if I wake up, I should brush, then bath, breakfast, then going to school. Like that, but instead of just words, you use pictures. So the child knows what he should do. Then the same pictures can also be used when you are teaching picture cards. And modifying environment. So the child is easily distracted visually, so you reduce the clutter in the environment. You use minimal objects. Whatever the child is using immediately, you keep the objects. Don't have too many wallpapers or too many multicolored things that might distract the child. And appropriate lighting. The child shouldn't be sitting in the shadow. And visual boundaries, in the sense, if I see that this is my study place, it should be different from the window. There should be contrast, good contrast visually. If I see the room, I should be able to identify different places have different colors. They are not mingling. And then the last strategy is self-regulation. Sometimes the visual stimming behavior, that is flapping of hands or staring at objects, spinning, even some children spin objects, keep spinning objects. That is also self-regulatory. That is they are taking too much information, or they are having too less information, they want to stimulate or they want to regulate, they go for the usual familiar visual visions. So instead of spinning objects or staring at lights, you can teach them deep breathing or taking visual breaks. In the sense, if they feel like overwhelmed by vision, you can give an activity, something like that doesn't use vision. For example, you can wear a blindfold and just touch an object and tell me what it is. It is also a good visual break technique. And after the visual break, the child will be able to focus better. Then other interventions are occupational therapy, sensory integration therapy, vision therapy. Vision therapy means in vision therapy you give particular exercises for the child to improve their eye-hand coordination, tracking, scanning and focusing. Example would be a flashcard where you have many letters and you ask the child to circle only one particular letter. A, where is A? You circle A. Or if the child is not able to identify letters, you can just give pictures and ask the child to find where the apple is or which is the odd one out. These are some vision therapy eye exercises. Then assistive technology. Assistive technology example would be magnifier, in the sense if the child has any power, and colored overlays means if the child feels overwhelmed by particular colors, or if the child is reacting very hypersensitive to particular colors, then we can change. If the object has that color, we can change it by having colored sheets with on over torchlight and changing the colors of the objects, or helping the child focus better if the child has a favorite color. And multidisciplinary approach means, see, occupational therapy, vision therapy, speech therapist, everyone comes together, makes a plan and helps the child overcome the visual challenges. So a quick recap is that children with autistic spectrum disorder have visual processing, atypical visual processing when compared to the typically developed children. The general differences are detailed focus processing rather than whole picture, then difficulty in integrating visual information, and differences in visual pathways such as ventral and dorsal pathways. So the common therapies are occupational therapy, sensory integration therapy, and vision therapy. And the tool used I showed is Vibe 8, which is short form for visual behavior. 8 is for 8 questions. So supporting visual skills obviously helps the overall development of the child. Thank you.
Thank you so much, ma'am. So I think we have finished with the sessions. So we'll be having a short panel discussion on different aspects. So I welcome Dr. Sravan Reddy sir onto the stage for initiating the panel discussion. Welcome, sir. So I also welcome Mr. N.C. Srinivas sir. Sir, please come on to the stage. So if audience, both online and offline audience, if you have any queries regarding different aspects, like we discussed about medical perspectives, assessment aspects, psychological perspectives, therapeutics, like regarding speech therapy, occupational therapy, then the visual behaviors of children with autism spectrum disorder. So any queries regarding different aspects, and or if you want to share something from your perspective, you can share that also with us. So I just request everyone who are here to come out with your own deliberations to enrich the session. Thank you. Yes.
First of all, I thank all the same person. It's a really a power-packed information. But one simple, what is the lecture? One simple question about as a parent, as a teacher, that with all this therapy, if a child more or less in a regular other students level, so is there any skill, is there any questionnaire, is there any department in MIPID who can tell that the child will shine in this field? Either he will go in computers, or either he or she will go in music therapy, or is that we all know that these type of kids are slow learners. So if in childhood we can find the skills or something positive in this child, so can expertise can say that this child will go to this skill or this type of career orientation or something. Okay. Yes. Actually, we all are working to make this type of kids in daily skills or regular activity. But what about this type of kids when they grow after 16 or 17 years? Is there any type of performer to find out these qualities in this child which help in their career.
Right. Thank you. Okay. Thank you so much, ma'am, for asking this question. Yes, we do have career aptitude tests which we use for career guidance and counseling. So, if the child is having, average or borderline intelligence, then we also rule out whether what is the aptitude area, like whether the child is good at numbers, whether he is good with the the clerical work, and also we do have aptitude tests which we do as a psychological assessment, and we can help the child to decide about the vocational guidance and counseling.
Which age we can do?
Usually we start this around 9 class, 14 years of age. So 14 years and above, yes, 14 years and above, we can help the child to decide about different career options and guidance. Right. The test name is a differential battery of aptitude. That is DBDA, David's battery of differential aptitude. And myself was involved with one of the tests which is developed by Ministry of Education called Tamanna and Aptitude Test, which is freely available online. So you can also look into that and how we can do it. We have the videos uploaded there. You can do yourself, and then you can take the help of a career guidance and counselor. So the test name is Tamanna, TAMANNA NCRT. If you will put, you will get that. Okay, and then you can take the help of any career guidance and counselor to get the counseling done for yourself or for the child. Okay, thank you.
For this professional thing and all, we have professionals in this field, like those who have done with the diploma in guidance and counseling from NCRT. They are professionals who is specially trained for finding out the career aptitude of children, and their focus is also on training children with the special needs also. So you can.
More or less same for the regular kids and the special kids.
Yes, yes.
Okay.
Okay, thank you. Yeah, there is a question in chat box in Google Meet that career options will be decided as per the interest or ability to perform, like that. There is a response for the question, and what's career option and how to groom them on social cues. There is another question in this chat box. So one thing is that regarding career option, first thing we have to find out their aptitude, in what area they have skills. So even differential aptitude scale gives us the clear idea about that. In what area we have they have skills, and in what way we have to forward. Like differential aptitude scale says that this skill based on the score, they will say that there is a person or this individual is having ability in mechanical as well as visual ability, or that person is having skills in verbal skills or technical skills. So that clear clarity we will get from that. From based on that, we can move forward for training aspects. And there are institutes which train children with autism in this way. Like I think Think College, something in New Delhi, they give specialized training for children with autism for career options. Like they have specialized courses for children with special needs. Then some other institutes are also there in Bangalore, some vocational institutes specifically focusing on autistic children. So there are organizations also, NGOs as well as colleges which does training on that. Then there is a question how to improve their language and expressing power. I think Sir will be able to answer.
Yeah, it's a generalized question actually which they have asked. There are so many issues to be taken care in expressive language. First thing is, based on the abilities of the child, decide what mode of communication you want to try. Many children with autism can speak. But again, depends on at what age we have started training. Like some people were talking about early identification, intervention, and also if you do it at a very early age, probably many of them will learn to speak. But however, if a child is not able to develop speech communication, doesn't matter. We can even go for alternate forms of communication, maybe using some pictograms kind of things, or even gestures, or sometimes writing. Many alternate forms are available. But for all these things, first thing is to actually improve their comprehension, understanding abilities. Once the understanding ability is there, maybe depending on the ability of the child, we can go for any kind of expression format. And preferably, of course, speech, if the child is having abilities to imitate speech sounds and all, like when I was presenting, I was talking about certain motor skills and all. So if the child can do that, yes, definitely we can go for speech communication. But it's a vast thing that you have to do in expression. So select a mode of communication accordingly based on the ability of the child, go for ultimately planning it. The ultimate thing is to express.
So, any more questions? Because we don't have questions in chat, Google Meet chat. You can also share your own experience. I think for students everything is clear, so they don't have any doubts. Or whether they were listening also, we don't know. So there is a question on YouTube. Which type of school is best for autism children? Either special or normal school. So first of all, I have to say one thing. There is no school called normal school. That is first thing you have to understand. There is no school, normal school. Everything is mainstream school. So for a child with autism, particularly if it is a high functioning child with based on their behavioral problems also, mostly we'll prefer for sending them to a mainstream schools rather than sending into a special schools. But one major aspect is like they will be able to learn from modeling when we send the children with the special needs, even any kind of development disabilities, to a mainstream school rather than sending them into a special school. So that exposure itself will be bringing lot of changes in the communication as well as socialization behavior and all. So that is always it is preferred to send the children with autism, particularly high functioning autism, rather than sending to a clinical setup of clinical centers, send them to mainstream schools. So that is one thing. And one thing, another aspect when we talk about sending them to mainstream school is like how they have been given support. Support is very important. If they are not being provided with sufficient support, then it will be a difficult thing to manage by the teachers, the peers and all. So that orientation or the sensitization about how an autistic child and what is an autistic child should be given to the peers as well as teachers. Then only they will be able to provide sufficient support. At the end of my presentation, I have given one slide saying that I'm not a problematic person. I'm not a problematic child. Just you have to understand I'm autistic. So that understanding should be there for placing them in a mainstream system. Okay, thank you. That is
So in the last just for 2 to 3 minutes, we are having one video. So what is the importance of early intervention in autism and other neurodevelopmental disorders? So how effective is the early intervention? So when you are identifying a child with autism or other neurodevelopmental disorders at an younger age, so there are few success stories which was documented by our early interventionist, Sri Dr. Rajeshwari. So she will be playing the video and she will interact with you for last 2 to 3 minutes.
Yusuf, 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 Yusuf. Yellow. Where is yellow? Blue square coloring कर रहे हैं Yusuf. ऐसे ऐसे देखो बुक में देखो पूरा नाम क्या है मम्मी का नाम क्या है बड़े भैया का नाम क्या है उमर खान यूसुफ की नोज क्या है यूसुफ कौन सा कलर शर्ट पहने ब्लू वाला शर्ट Roll your hands. Roll your hands. Roll your hands. Roll, roll. Hands up. Clap your hands. Oh, Yusuf. Very good. इधर इधर Yusuf. Circle. Very good. Right A. Here B. C. Play, play, play.
So I think Sunita madam will be able to answer that question. So if the child has not much problem in social interaction but has sensory processing issues, will the child be falling into the spectrum?
Yes, when we say the child with autism, every child is individual, may different symptoms and a different way of behaving. So even if the child is not, even if the child is having good social interaction, so we have a spectrum like high functioning children with autism, Asperger's syndromes and all. So they may have very good with the understanding, comprehension, may be lacking language or communication, or maybe lacking only social interaction. So they fall, and that's why it is called spectrum, ranging from one to the higher one. So every child with autism have different presentation of all that. So definitely that will fall in the spectrum disorders. Yeah.
Thank you, ma'am. So, another question, regarding training center who can help to nurture skills or identifying the same with such kids in Delhi NCR. So, one thing, it's like we have a regional center over there in Noida. So, they will be able to help for assessment and identification and further program planning. So that is one center which we have. And other than that, cross disability early intervention centers are there in national institutes under DEPWD, like IPS is having a close disability early intervention center. So that is also located in Delhi. Then several other centers are also there.
So you can just log on to our website, nipit.nic.in, and you can have the links of different organizations in the field where they are working with a disability. And we also have the regional centers, as I has mentioned, in Sector 40, Noida. So you can go for the diagnostic assessments and then intervention planning also.
I think no more questions. Students? So no questions from student side at all. So, I welcome Dr. Sravan Reddy sir to conclude this half-day program. So, welcome sir.
Good evening, one and all. And I thank both the offline and the online participants for showing active participation and showing your interest. And every year we are organizing this webinar. So I think this organization of webinars and awareness programs should not be restricted to only the Autism Day or Autism Awareness Month. Anyway, from NIPID and from our NGOs and our regional centers and CRCs, we are doing throughout the year these kind of awareness programs throughout the country. I think these kind of awareness programs create in general public for early identification of these kind of disabilities and early intervention and referring to the higher centers. So which has a lot of implications, particularly in the rural areas. So where they are lacking of all these rehabilitation professionals and the mental health care professionals. And I thank our director, V.V. Ramkumar sir, Director Officiating, for giving us these opportunities and for creating these kind of webinars and conferences on autism and other kind of neurodevelopmental disorders. And I thank all the participants. And I thank our technical team, Rahul, and our estate officer, and Gautam, Rishi, and our early intervention team, and all the support and all the speakers for making this program a grand success. Thank you, one and all.